Un attimo solo, aspettiamo.
Good morning, welcome to all of you. And today we are talking about emergencies and crisis, and we have the honor to have here to open the day Professor Spyridon Flogaitis, that is director of EPLO, that is kind host for us conference. So we give many thanks to Professor Spyridon, and please, the floor is yours.
Ladies and gentlemen, thank you very much first of all for waiting for me to come. I was having some exams, medical exams, routine medical exams which are needed. I would like to thank you all for being here today, and especially the organizers of the One Health Conference, which is taking place with the cooperation and the support of the Institute for Global Health Emergency Response and the Circular Economy and Climate Institute, both institutes of the EPLO, with the scientific cooperation of the Global Pandemic Network. The Institute for Global Health Emergencies Response is IGHER. It is more easy for me to call it IGHER. Is the result of the opening of our office in Rome, Italy, which took place on 22 May of this year in Palazzo Altemps, in the heart of the Piazza Navona, in presence of His Excellency, the President of the Italian Republic, Professor Sergio Mattarella. And it is the initiative of the EPLO because we opened this office, but it comes out of the mind and the dynamism of a person who grew up in this organization, scientifically, perhaps also biologically, Professor Matteo Gnes. It was his idea, and he is animating this institute, which is our first institute with headquarters in our office in Rome, not in Greece. The Institute organizes a series of events, and this one, it is organized in cooperation with the Circular Economy and Climate Institute, which is the result of the spirit of a well-known environmentalist, lawyer, and administrator, George Kremlis, who spent all his life in the appropriate organs of the European Commission. I would like to thank you for taking this initiative to come to our headquarters in Athens, Greece. As you see, we are in between the Athenian Agora, which is on your left when you go outside. The Athenian Agora is the place where democracy was conceived, because the Greeks, instead of going every day to work as the Germans would like us to do, they went to the Agora and they developed the political philosophy which dominates the world. And on your right, when you go outside, is the Roman Agora, which tells you something more, you Italians. And we say that this represents for us the concept of state, because the state, the public powers, law, science of law does not come from the Greek tradition, it comes from the Roman tradition, of course, full of Greek ideas, but the main concepts come from there. So the Greece gave us this place because Greece wanted us to have a possibility to bring you friends from outside of Greece to a place which by itself represents something because of its position. So enjoy this position for as long as you stay with us. Please allow me on this opportunity to thank the person who is, you know that this person here is your Professor Chrysanthi. Chrysanthi was the name, you know, and Chrysanthi is a Greek name, you know that. Chrysanthis, yeah, right, yeah. Because, you know, there are many people who do not know that a big number of Italian and Greek names are the same. In yesterday, I was reading the newspaper for about a certain person, Fellini. Fellinis tells you something, you see, but for them, the name is Italian. For us, the name is Greek. Who knows? Faturos. For them, the name is Italian. For us, is Greek, and many others. Mela, Zambelli, Spano, who was famous 2 days ago. Spanos, sorry. Bulgari, see, a famous name. So I don't want to keep keep you more. I just wanted to thank you for being here. I want to thank the Greek personalities who came to enrich this discussion with their presence, experience, and last but not least, to thank IGHER, to thank the Circular Economy and Climate Institute and the Global Pandemic Network. So the One Health Conference is already taking place. We are grateful to you for bringing this initiative here. Please feel here at home. The EPLO was born in order to unite peoples, cultures, and mentalities, and we are happy that Italy is so much present in what we do. Thank you very much.
Thank you, Professor Flogaitis. You have named the circular economy, So I think that all of us, especially Mediterranean people, can take many experiences from the past and apply in a circular economy vision to the present and the future to avoid disaster, crisis, and war especially. Thank you very much. And now I give the floor to Matteo Gnes, Director of IGHER, EPLO, and Professor of Administrative Law at the University of Urbino in Italy. Thank you, Matteo. The floor is yours.
Thank you very much. Thank you very much to the real organizer of this conference for being here. So it's a pleasure to be here with all of you. We have yesterday an approach from, we say scientific, we say hard scientific, medical, ecological perspective, and so on. We have lawyers, so we will explain you how this connection between law, actual lawyers and scientists took place. Anyway, why we established IGHER, why we start also working together with Elisa, Scotti at the Global Pandemic Network. The starting point was COVID-19, because COVID-19 was a dramatic experience, but it has been something very impacting from the legal point of view. I don't want to steal too much time, so I will be very fast. Okay, thank you. So I will just see these few words that come from a report of the International Red Cross. Okay, they say that COVID-19 made a huge amount of legislation to be enacted. I'm not going to write to read it all, but at the end, never before have so many laws been made in so many countries in respect of one event in such a short time. It was a flood of legislation, of rules, administrative provision at all levels. It impacted to our life in a very consistent way. So this is COVID-19. And why are we talking about the other way? Okay, thank you. What are the lessons we can draw out from COVID-19 experience? First, it is very important to connect, to look together, legislation, science, technology. We have to open our minds to have a more comprehensive approach to all of this, probably because they are strictly interrelated. Remember, law should come after. We often have the idea that law can be before everything. We are lawyers. So for us, the law is the starting point. Actually, law should be the connection between many problems that arise from social sciences and from other scientific experiences. Second, also the legal management of that experience should be evaluated. And there is then the medical health management and the special concern its organizational issues, the administrative management, and then, as I told you, we should start thinking of a more comprehensive approach. Is the more comprehensive approach One Health? Could be enough? My idea, we should also go beyond One Health, because we should have even a more comprehensive approach to this. Now, next, we know what is One Health. Actually, you know what is One Health in your experiences, but sometimes this is what the law it is good for, because lawyers need to provide definition. So what is One Health from a legal point of view, but it's not a real legal point of view, from, I would say, a vocabulary point of view? It has been defined in this quadripartite definition between the four most important international organizations that deal with this problem. It is an integrated, unified approach that aims to sustainably balance and optimize the health of humans, animals, plants, and ecosystems. This approach recognizes the health of humans, domestic and wild animals, plants, and wider environment, including ecosystems, are closely linked and interdependent. Okay, so this is the basic starting point. Which, from this, you know, lawyers from specific principle, they take out everything, which also you have done, I've been doing these days. Okay, so, but this is the starting point. It's always useful to keep in our mind to what One Health approach means. Then the problem is, what are the consequences of this? Second, why IGHER is involved? IGHER, as you will see in the last slide, has to do with emergencies, while One Health should be something that should not be related to emergency, maybe also to emergency, but not only. Should be the preventive side should be the most important one. We should think of when we do anything. When we want to build an hotel in the middle of the forest, we should think of what could be the impact on the plants, on the discovery of new viruses because of animals that have never been in touch with the humans. So this should be a preventive approach to One Health. But One Health has been included also in the proposed treaty on pandemics of the World Health Organization, and there is a specific provision, is Article 5, that address the problem of One Health also as regards emergencies. We have to think about, of course, One Health is a very global approach, but we have to think about that also in the framework of emergencies, we have to have a more comprehensive approach. Finally, IGHER. As Professor Flogaitis kindly told us, in this legal international organization, we created an institute that has to do with response to global emergencies. Of course, it was established in 2021 when we were still in fight against COVID-19. The idea was to have a body that should address these problems from a legal perspective, made up of lawyers, but working together with scientists. That was our idea. And so this is one of the initiatives that we are making jointly with our friends scientists. They already work with us in another occasion and with the Global Pandemic Network. So we are trying to put together all of our strength. So all of you are invited to join us, to work with us, to share your experiences, to let us growing, not for us, but because we hope we can provide some good ideas in case of new emergencies will take place. Thank you very much for your attention.
Thank you, Matteo. And we have here the president of Global Pandemic Network Steering Committee, Elisa Scotti, full professor of Administrative and Environmental Law, and she talked about the global pandemic. Thank you, Elisa, and the floor is yours.
Thank you, Margherita, and thank you, Domenico, for having me here, and thank you to the EPLO for the kind hospitality, but also for the important connection and cooperation. First of all, I want to say that I'm not actually the president of the Global Pandemic Network. We actually miss a president. I'm only one of the founding member and a member of the steering committee. And now we are deciding the president, and I think I can anticipate that he will be Kasimbasi, Professor Kasimbasi from Uganda. It is because our network is a global network and is okay. 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 The next slide. Okay. Okay, it is a global community of scholars from all around the world, and okay, I think that now it is working. Okay, thank you. From scholar from all around the world, and we. Okay, perfect. And we built this community, which started as a group of friends with also Matteo and other friends from UCL in London and Roehampton University in London and other universities in the United States. And one of our founding member and very active in the first steps of our network is Professor Nicholas Robinson, one of the forefathers of environmental law. And we built this community, and as a wave, it goes to include a lot of different universities around the world. The moment was critical for the COVID-19 pandemics, but also was a moment when the world was united for this problem. I think that in this moment it could be possible, but at that moment all universities and all scholars from United States, from Africa, from South America, from Europe, from Asia, from Singapore, Taiwan and China, they also still are working together. So from New Zealand, and I think that we cover different continents of the world. So we are really proud, but it is not something that it depends on us, but especially it is something that we have to acknowledge to our younger participants in the network. And so this is a picture that is more or less representative of our participants in the network. And it is our main pillar of research, human rights, governance, and environment. And it is our institutional cooperation with UN Habitat, with IGHER, which is, I don't know if I can say our institutional output. We are a network without an institutional framework, and with the friendship and the kindness of Matteo, Gnes, and the EPLO, we put together our effort, and so we have these two sides together. And we also cooperated with the WHO for building an open access case law database for COVID-19 all around the world. And we will give you details to access to this important database. We gave a contribution by allowing our young researchers to participate in this important project. And also we, Matteo mentioned the Convention on Pandemic, the International Convention on Pandemics, and we are really proud because we gave just a little contribution to the International Center for Comparative Environmental Law. The president is Michel Prieur. He should have been here today, but now he's in Colombia to the COP16 of the Biodiversity Convention, Biological Convention. So, and he is the president of the International Center for Comparative Environmental Law. And with them, we cooperate in writing a draft convention based on One Health, a draft convention on pandemics. And okay, and also the Human Rights Consortium of the University of London is one of the founding partner of this initiative. Okay, just a few words and brief word on our approach is building resilience on human rights and environmental protection. What is this? And the starting point is a legal point of view, but we included in our vision different perspectives. And so what is resilience for us? We know that we are building a more resilient society. So the idea of the network is to give his contribution to build models of resilience based on human rights, environmental protection. It means to be brief and holistic perspective, the priority of ecological resilience is a precondition for all the other resilience. So we know that we are building social resilience, institutional resilience, economic resilience, health resilience, but the precondition of all these resilience is to build an ecological resilience. That's why our legal approach is an eco-law approach, based on the principle of prevention, of precaution, of non-regression in the protection of the environment and eco-proportionality. And last but not least, respect of human rights and justice, because our vision is human rights centered, not eco-centered. The EPLO approach is in our vision is in order to protect the human rights of people around the world and justice. Next slide, please. So we try to build this and to start our research with this vision in our first global conference on cities, COVID-19 and cities. And it was in 2020, and then in the second conference in 2021 with the cooperation, the first important cooperation with IGHER and the EPLO. And the focus was on the response of the governance response to COVID-19. And the third was digital society. And the fourth is on healthcare systems. And the last, when we met Domenico and Margherita, was last May in Rome, Macerata, and Urbino, 3 universities. Yes, it's a moving conference. And it is where we met Margherita and Domenico, and you can see here the picture. In Rome, we were in Sapienza and in the headquarters, in the IGHER headquarters in Palazzo Altemps. It was a real privilege for us to be hosting in such an important place. Palazzo Altemps in Rome is an historical and important palace. And so lastly, our publication, the place where we try to widespread our research is this journal, Legal Policy and Pandemics, the journal of the Global Pandemic Network. And our last conference in Rome was on One Health. And now, so we are collecting, we are building special issues on One Health. And the first issue will be published at the end of this year, but there will be other issues. So all of you are strongly invited, encouraged to participate if you want to give your contribution to this journal. And we would like to put together the strength with the IGHER, but with these important initiatives that we are experiencing today, this World Conference on One Health. And so I thank you again to Professor Ferrante and to Domenico for this kind and important invitation. And so I concluded my brief introduction on the network, and I think that now we can start our discussion.
Thank you, Elisa. Thank you very much for this great opportunity for us to collaborate, to link with the global pandemic and in a fruitful synergy that I hope in the future can have many work on this important and very good topic. So we start with the opening keynote of the day. We have Professor Sotirios Tsiodras, Professor of Medicine and Infectious Disease, National and Kapodistrian University of Athens Medical School. Professor is here with us. Thank you, Professor. The floor is yours.
Dear organizers, distinguished professors and esteemed guests, it's a pleasure and an honor to be here among you. Over the last 5 years before And immediately after the pandemic, I've been talking to communities about the importance of climate change as it relates to my profession as a medical doctor and infectious disease specialist, but also its public health aspects. I know more of you, a lot of you are more equipped to talk about this. I'll just give you an idea of how I approach this subject in my talks, and the discussions I have with local community members are very, very interesting. I'm looking forward to advocate for this issue more in the future. I'm not going to talk about all the parameters. I'm going to give you ideas. We know about greenhouse emissions and gases and how they contribute to global warming. Carbon dioxide, methane, nitrous oxide. You see, it's more a linear association. Surface air temperature, 23, 24 are the upper curves in this diagram, in this slide. And I think it's important to realize that compared to pre-industrial ages, this is a continuum that's getting worse. This is sea surface temperature. You're going to be talking about this most likely during your sessions, and probes with sea whales and sea lions that have been heavily affected by avian influenza this year in Latin America. And we follow this, and the two upper curves again are 23, 24. A planet that's literally burning. This is sea level change with the little red circles. The red circles show areas where flooding occurred over the last decades, and this is really a very interesting slide to show that this sea level change will affect small Pacific islands, will affect Marshall Islands, the third power in the world as far as ship ownership. And this is a photograph from NASA, and there was a United Nations a technical report that was issued on September 24 that shows that this has become irreversible. And we're going to be seeing things that we're not prepared for. And it's amazing that people do not know about this, and we should advocate for this. And what Antonia Gutierrez has been saying from the United Nations and the Samoan leader, this is a crisis that we are responsible for. We made it, and we must act and answer the SOS before it's too late. And by saving the Pacific Islands, we're saving ourselves. The sea ice content is decreasing. Thousands of glaciers melting over the last few decades. Toxic orange rivers in Alaska and elsewhere from iron, cadmium, and other heavy metals. New pathogens that have been identified by premier microbiology groups in the glaciers by doing specific microbiology, new molecular techniques to identify pathogens like Mimi virus and megaviruses that literally we do not know the consequences if one of those escapes and affects the human race. Ocean acidification, the pH of the ocean, the ability of the ocean to absorb CO2 has reached its maximum capacity, and we've been seeing this affecting life forms of the ocean, like the pteropods, the sea butterflies that are losing their shell. It's basically dissolving, and I think this is very important. This is food for whales. This is for food for sea mammals. They're very small. They're the size of a pea bean. And I think we shouldn't overlook the fact that whatever is happening is affecting the whole ecosystem that the planet. Let me go back. And extreme weather events. Plenty of those over the last year. This is tributaries of the Amazon from the New York Times. They're drying up. This is the floods in Dubai earlier in the year, and in Europe early September, Germany, Belgium, and other countries, heavy flood loss, losses related to flooding, and immediate reports, scientific reports associating these flooding events with climate change. This is Hurricane Helene, boosted by the warm waters of the ocean. This is Milton, couple of weeks ago, wind speeds up to 150 miles per hour, and exacerbation of events. The rapid intensification of Milton was a result of climate change. This drop of 50 millibars within 5 hours, there was a meteorologist crying on the Florida news station. You probably saw that in the news. And it was amazing what happened within a few hours in the Gulf of Mexico. And it was all related to sea warming. And of course, the Greco-Roman wrestling, I don't know if Professor Flogaitis is here, between science and misinformation. One of the civilians told me that one of the bad outcomes of this pandemic was that a large proportion of our fellow civilians lost their trust in science. And this is something we need to fight with because natural events are not engineered, probably made by us years ago with the decisions we took. I'm not going to talk about parameters. I'm going to focus a little bit on infectious diseases and give you some short examples. This is multiple pathways to exacerbate infectious disease, especially through vector ecology effects. We have the national entomologist here, Professor Michaelakis, is going to be talking to you about diseases like malaria. Last year's WHO report, climate change drives epidemiology of malaria in several parts of the world, responsible for more than 3 million cases in Pakistan after the flooding of 2022, and when 1/3 of the country was underwater. And of course, the situation that we talk about, climate migrants. A lot of people were displaced, and this is something important. We need to talk about it. It was funny, you know, with Milton in Florida, they criminalized homelessness just before the big hurricanes, and then they had to deal with criminal victims of the flooding. Anyway, another aspect of the whole issue, dengue in the Americas, more than 11 million people, millions of affected cases in Brazil. Industry is in the game, creates billions of modified mosquitoes carrying the Goldbach parasite to decrease effects of dengue transmission within the tropics. And the predictions, this is West Nile, a disease we've been affected from over the last 15 years or so, is expected to spread throughout mid and northern Europe over the next decades. I'm not going to talk about food. You know, undernutrition is a very important political and global issue. Food safety and quantity and undernutrition is responsible for lots of deaths in little kids. I'm not going to talk a lot about water, water quality and quantity. They say the next war is going to be about water. But what I want to talk about is we know that we have a post-heavy rainfalls and flooding, increase in diarrhea episodes due to cancer enteritis, and of course in Africa it's cholera. And in Germany, it's Cryptosporidium that stays within the soil after flooding. This is an epidemic of 165 cases in little kids in Germany after flooding events a couple of years ago. We developed new scientific frontiers, and disaster microbiology is one of those. You see the sandstorm in Phoenix, Arizona, and you see the wildfires in California. With drones, they have identified funguses like Cryptococcus, like Aspergillus, coccidioides, that's endemic in the area, and creates huge epidemics. And of course, firefighters can catch this infectious disease as well. Does it increase the risk of a pandemic? We have more and more. We learn that this climate change will increase the risk of the pandemic, will increase the interface between nature and us, humans, and we need to develop surveillance methods. And this is a paper from CEPI that outlines this increased risk, and we need to be on the forefront, and we need to have new molecular testing at the interface of this. Other effects, cardiovascular disease, increased risk for heart attacks 50 days after flooding. Cardiovascular disease is expected to increase by 200% in the United States in areas affected by heat waves. And we know that green space decreases the risk of cardiovascular disease. A big meta-analysis with 100 million people included. And of course, other effects, I don't have time to talk about cancer, increased lung cancer risk from microparticles. We have papers in Nature last year, and we have papers with high-risk professions like firefighters and increased risk. What's the future? Is it going to be sponge cities? Do we have to bombard the stratosphere? Do we have to build a seal to elevate Jacob's Heaven, the biggest glacier iceberg in the world? Do we have to create factories that will infiltrate our rivers with limestone, as they're doing now in the Americas? They have huge companies investing in limestone, water that they put in rivers, and in order for the rivers to absorb more carbon dioxide. We definitely don't want to be going for ice skating in the Arctics. They're not ice skating in the Netherlands anymore. And in conclusion, it's a polyparametric phenomenon. It's not only infectious disease, it's public health overall. It's important drivers exist, and socioeconomic drivers as well. I didn't have time to discuss about this. We have important consequences for human health. I think it's a multidisciplinary effort. We need to advocate for this. We need to go at the forefront of this. It's a battle. It's a day-to-day battle. We need to convince our political stakeholders that we need to fight for this, because it's the future. It's our planet. We need to take care of this planet. There's simple things that we can do. I'm not going to talk about the 9 things you can do from the Imperial College London, like take your bicycle to go to work, or eat more of a vegan diet, or talk to your community about this. And this is what I've been trying to do over the last few years. And hopefully with my scarce publicity from the pandemic, I can convince some people that this is a real problem and we should protect our future. Thank you very much.
Thank you, Professor Tsiodras. This is a very amazing presentation, and you have talked about fundamental topics for our health, for the health of the planet. Thank you. And today is the World Food Day, and we have here Professor Antonia Trichopoulou from Greek Academy of Science that talk about Mediterranean diet, fundamental topic for our health. So please, Antonia, the floor is yours.
Okay. Good morning to everybody, distinguished audience, dear colleagues and friends. It's really a privilege to be here with you today, and I thank the organizer for giving me this opportunity to share you some thoughts about the link between One Health and the Mediterranean diet. Okay. Having said that, I want to start with the saying of one person who was walking here in ancient Athenian Agora. At that time, the Roman Agora did not exist. Is an ancient philosopher who actually was born in Asia Minor, but he traveled all around the world. And it was his saying, which said that the beginning of a right education is the examination of words. Why am I saying that? Because we are using words to communicate. And maybe for some of us, the term One Health is not clear. We were given a very analytical definition of One Health before by Professor Matteo Gnes. And then, well, this was developed several years ago by big organization and apparently by large committee and expert and things like that. But yet I was in a meeting where there were some person which they were discussing and commenting about, about this definition. So we have to clarify again and to think what is meant by One Health, the definition. What this Antisthenes was said 700 years before Christ. So, I don't know, don't know how to. Next one, please. The experts in a recent meeting I was with this kind, and they were to clarify the difference between environment and ecosystem. I do not know to expand on that, first of all, because I don't know what to say exactly, but still there are some questions of when we're defining the One Health definition. So, in brief, in my today presentation, well, One Health is an integrated, unifying approach, integrated, unifying, in order to describe the sustainability balance and optimize the health of ecosystems. And usually, as I mentioned before, the term ecosystems is very close to environment, and we do not know the limits of the ecosystem and the environment. So, I don't know how to move. Αυτό είναι το πάνω. Το μπροστά, sorry. Λάθος μου το έπαιξε. So, I think that the previous speakers, Dr. Matteo Force, he has an approach describing the legal approach of the One Health. And then Dr. Tsiodras spoke a lot about the link of One Health to One Health to the human health. May I say to you that the One Health, the central issue is not the human being. In the One Health, we take into account the animals and the ecosystem, the environment. And this, I think that in this definition, is the things which we have to pay much more attention. It's not the central issue, the human being, because this is interdependent of the animal's health and of the environmental health, as clearly was presented by Professor Scotti, Professor Tsiodras. Thus, well, we have to examine the synergies between these ecosystems and the various issues like human health, as it was done previously. And then Sotirios spoke very analytically about the influence of the ecosystems to the spread of vectors, to the pollution effects, to the ecosystem changes. And also he mentioned about food. And may I remind you that today is we celebrate the World Food Day. And when we're talking about resource scarcity, if the ecosystems change, and if the environment does not work very well, then we have a huge problem in the production of food and the availability of water. So, having said that, in the One Health approach, there are several actions which are taken to face all these problems which they were described previously. Disease surveillance, it was clearly mentioned by Professor Tsiodras. Genetic diversity. Why in many aspects of genetic diversity, more specifically about the food, why to import seeds for tomato cultivation in Greece, and then to abandon all the cultivars, the traditional ones, which genetically they were adapted to the environment? Just a very brief example. And then the efficient water use. And everybody knows now that we have a big problem, and the problem is going to be bigger and bigger and bigger. And then about climate change, you know that in Crete, in southern Crete, in 10 years, southern Crete is going to be a desert. You know that this year in southern Crete, the olive trees, they blossom, but they do not produce olives. So the problem is here. It's the environment, it's the food. And then, having said that, I want to mention a report which was published in January 2019 by the Lancet Committee. The Lancet Committee was a committee developed by the Lancet, of course, the journal, our journal, and they worked for more than 3 years. And their aim is to find out which diet of the world should be recommended, not as healthy only, but as sustainable. And when we're talking as sustainable, we mean all these things which they are recommended by One Health. It's not only the man, the human being, who is the central person in this diet. It's the environment which dictates the condition of having healthy food. And this report, I think that has influenced a lot, not only the scientists, but also it's discussed also in the political arena on what should be done in the coming year. And it has been done and decided soon. We do not have enough time ahead of us. The climatic change is here, and it's going to worsen and worsen and worsen day by day. So, in the One Health strategy, they propose some sustainable practices: disease surveillance, genetic diversity, efficient water use, ecosystem restoration, and then many activities on the community level, on individual level. It's, for example, and we'll come to get that later, do you know that we need to reduce our meat consumption? This, first of all, is an individual decision. It's not only a community decision. It's an or an industry decision. It's an individual decision, because the power of the consumer is much bigger than anything else. They produce what we consume. And then, I'm thinking, no, I'm sure, again, sorry. So, in this committee, in this Lancet committee, they developed one diet, a universal diet, in which was calculated that if it was applied by the 1930, 11 million deaths per year were prevented. That means 19% reduction, less premature mortality by the year 2030. If this diet, which is recommended in the Lancet proposal, and then in the Lancet proposal is mentioned you moved, I don't know. Next to next to this. So, in the list, I want to mention before going to what is said to this Lancet proposal about the Mediterranean diet, that the last decade the Mediterranean diet has evolved from a healthy diet to a sustainable diet. May I remind you that the year 2010, the Mediterranean diet was included in the list of intangible cultural heritage, not because it was a healthy diet, but because the practices which they were used, they were for the production of food, they were sustainable. Nobody mentioned this point. Only we focus on the health aspects of Mediterranean diet, but the inclusion, the Mediterranean diet as an intangible cultural heritage, the way which was produced because it's a cultural heritage, it's our traditional foods, it's what we are doing every day. And then, I don't know. No, the previous. Well, the previous one. Sorry. The next one. I want to tell you something else, that since 40 years ago, almost, the person who they were working in the environment, they said that diets and the activity of the food supply is responsible for almost 1/3 of human-caused climatic changes. What we are eating, 1/3 of the climatic changes are due to what we are eating, to the food systems. That's very important because we never speak about the food systems. We never speak about what we are eating. And it's 1/3. We're speaking about how the fuel is produced. We're speaking out about our cars, but how the energy is produced, that 1/3 of the energy and of the greenhouse emissions are due to the food systems is not pointed out. Next, please, because. So, what I want to mention, and I finish after a while, is that last year in the Dubai conference, 134 countries, they agreed and they announced that we, heads of states and government, we affirm that agriculture and food systems must urgently adapt and transform in order to respond to the imperative of climate change. It's the first time the United Nations and 134 governments, countries, they say that we affirm that agriculture and food systems must urgently adapt. What we're doing that about the food systems? And the food system is not very analytically dealt by One Health. Next, please. May I tell you that also the Mediterranean diet for the 7th year in a row was the first best diet in the world, according to a survey run by the United States by the United States News and World Report for the 7th year. It was selected the best diet not only for health, but most importantly, for taste, because nutrition and foods is not only an account of calories, it's a pleasure. And it's not only a pleasure, it's a tradition. Reflect the way we're living, our values, and what they were given us from our fathers, and we have to transmit to our children. Next, please. So, I think that, and that's the slide I'm missing, that in this report, in the Eat Planet report, it was mentioned clearly that this universal traditional diet supported by the Lancet Committee paper is based on the Mediterranean diet paper, both because it's healthy and it is sustainable. Having that in mind, more specifically, we, the Mediterranean, we have the best diet in the world. Why we're abandoning it? You know now that there are papers which the children in the north, they are eating more, they are adhered to Mediterranean diet more than the children in Cyprus and in Italy. Unfortunately, in this study, Greece was not, it's not comprised, but it was Cyprus and Italy. And then we have from our national survey, IGHER, we see that only the person more than 65, they adhere to the traditional Greek Mediterranean diet. And all this issue, they have to do with One Health, with the food systems, with our legislation, and what our nutrition policy. And of course, on the top of all of that is One Health. And this is our duty. And I ask you to help on that. Thank you.
Thank you. And surely the Mediterranean diet is the right way to being and living. So you have talking about this in the right way, because children are our target for this important topic for the health, for the planetary health. And now we have to anticipate Jess Beagley, because I have some problem. That is a Global Climate and Health Alliance Society. So it's online. Thank you. The floor is yours.
Thank you so much, and it's a real pleasure to be here today. Let me just share my screen. Does that work okay? Can someone tell me?
Yeah.
Yeah,
Please.
wonderful. Thank you. So I'm going to try and link today some of the health impacts of climate change and the wider One Health discourse to what we see happening in UNFCCC policymaking. So I'll run through really quickly some of the health impacts of climate change that we're seeing in the Mediterranean, and then link these two different processes that will be ongoing at COP29 in Baku in Azerbaijan, and what some of the tensions are that need to be overcome to reach good health outcomes. So there are four health impacts of climate change that are relevant for the Mediterranean that I'll briefly touch on. Of course, there are many others in addition, but using data from the Lancet Countdown, we can see that there is an increase both in Europe and in the EMRO region, so encompassing many Mediterranean countries, on the number of heatwave person days that are experienced in infants, also in older people, but recognizing that there is a particular focus in this meeting on maternal and child health. And we know that infants are particularly negatively affected by heat because of their inability to regulate their heat, as well as older people. We're also seeing increased wildfires, especially in Greece, very sadly. So in July 2023, I'm sure so many people that are present physically today will know about devastating wildfires that occurred in Greece, but also more widely in the Mediterranean, with deaths and many, many injuries. And in particular, only 2 months ago, there were forest wildfires that reached the very outskirts of Athens, and this was really brought on by the fact that we've had the hottest ever summer in much of the world, and certainly including Greece. But this, combined with severe decreases in rainfall, really set up the ideal conditions for wildfires. And of course, in addition to these very acute deaths, there are many, many long-term impacts as well. Thinking about the air quality, but also the long-standing mental health impacts. We also see increases in food insecurity for projections in different warming scenarios. The Mediterranean may be slightly less severely affected by other parts of the world, according to this Lancet Countdown data, but you can see that by the time, if we ever reach 3.7 degrees of warming, that food insecurity is going to be an increasingly severe problem and very noticeable and devastating in the region. And finally, on the transmission of infectious disease, you can really see that the Mediterranean shows up as a really dangerous hotspot for areas that are suitable for transmission of Plasmodium falciparum, based on the areas that are suitable for Anopheles mosquitoes. We know that mosquitoes like it warm and they like it wet, and the Mediterranean is going to be getting warmer and wetter. So how does all of this link to what's happening in the UNFCCC? So I'll give a quick overview of how we've seen health in general feature, and then try and link it to these specific climate impacts that are relevant in the Mediterranean and beyond. So in the convention itself, from the very early 1990s, the UNFCCC convention actually recognizes the impacts of climate change on human health. It doesn't link that to animal health, but references to human health and to public health. In the Paris Agreement adopted at COP21, there's reference to the right to health. And then at COP26, of course, Adjacent to the negotiations, we saw the COP26 health commitments, which have now become the Alliance for Transformative Action on climate change and health, with many, many countries signed up to low carbon, resilient and sustainable healthcare systems. At COP28, health really mushroomed, and we saw that there was a dedicated UAE declaration on climate and health, which also makes specific reference to One Health. There were $1 billion of finance that were announced for climate and health. And for the first time, we saw health really getting traction more deeply within the negotiations. There's a health target in the UAE framework for global climate resilience, which I'll talk about a little bit more in a moment. At SB60, we saw lots of mentions of health in different negotiating tracks, so we can really see how the COP28 declaration has made parties think increasingly about the intersections between health and the climate issues that they're negotiating. A lot of the impacts that were discussed at SB60. So this is the preparatory meeting that happens in Bonn each year in preparation for COP. Just made it so much more tangible, and it's certainly not something that we've ever seen before. And it wasn't just general mentions of health; it was specific health impacts that were relevant for different countries that governments were finally speaking about. And a lot of these actually came up in a dedicated dialogue on children. So again, relevant for this maternal and children's health focused. But what we're not seeing yet, although there might be mentions of health, we're not seeing healthy climate decision-making. We're not seeing healthy outcomes from negotiations, and in particular on finance. Just as an example, COP29 is supposed to be the COP at which there is a new finance target that's agreed. But in Bonn, governments weren't able to reach agreement on many of the key criteria that are going to be necessary to pave the way for that new climate target goal to be productive. That's the new collective quantified goal. Also on mitigation, although everyone was really excited about the language that was agreed in Dubai on transitioning away from fossil fuels and energy systems, that was in the overall decision from the conference, but it's not yet been translated into any work programs, any work streams that are ongoing right now. And there is real opposition to looking at how that language on transitioning away from fossil fuels and energy systems could be picked up in the work program of the UNFCCC that's focused on mitigation. So at the moment it's stuck, it's really blocked. So what we really need next is not just health being mentioned in the negotiating rooms, but we need those healthy outcomes from climate decision making. We need finance for climate action. We need real commitment and deep, deep work to figure out how we're going to transition away from fossil fuels, just as two examples. In terms of where some of the most explicit health links are in the UNFCCC, many of these relate to adaptation. So we're all familiar with the idea of building more resilient health systems to address these health impacts of climate change that we're seeing more and more. And as I mentioned before, there is a health target in this UAE framework for global climate resilience. And to explain where that came from, that framework, if we go back to the Paris Agreement, we all know it's most famous for the 1.52 degrees Celsius target. But there are actually other goals that are buried in the Paris Agreement too, one of them being on adaptation. And while for mitigation, it's quite simple, or comparatively simple, to measure the extent to which progress is being made. You can measure how much the world is warming, you can measure how much greenhouse gas emissions are increasing, but adaptation is so much more complicated to measure because the impacts of climate change, whether they're health related or otherwise, look so different in different parts of the world, and you can't come up with a simple way to measure progress. So even though the Paris Agreement was adopted all the way back in 2015, it's taken until now, until COP28 at least, to have a framework to figure out how progress is going to be measured towards it. And we're doing that now with the UAE framework for global climate resilience. So this framework has 9 thematic targets, including one that is focused on health. That health target is attaining resilience against climate change related health impacts promoting climate resilient health services, and significantly reducing climate-related morbidity and mortality, particularly in the most vulnerable communities. But really relevantly, in addition to this very health-focused target, there are others that are relevant for the ways that we think about One Health and planetary health as well. So there's a target on water that includes mention of potable water, so a real health angle there. The food target talks about nutrition. Ecosystems we know are so essential for One Health with so many intersections there. And then also infrastructure and poverty and cultural heritage, so looking more at the social determinants of health. Aside from the global goal on adaptation in the UAE framework for global climate resilience, we know that health also is referred to in national adaptation plans. These are one of the ways that parties can submit their plans for adaptation against health and other sectors that are threatened by climate change. According to the UNFCCC, not every country has a national adaptation plan, but many do. Some submit adaptation information in their nationally determined contributions, their NDCs, or also in other documents. But what we see in these national adaptation plans, thanks to analysis by the World Health Organization, is that health is one of the top 3 sectors that's most referred to. So there's real recognition from parties that we need adaptation in the health sector. And then the other top 2 mentioned sectors are water and agriculture in addition. So how do we turn all this into something concrete that can be monitored under the UNFCCC? So what we're hoping to see happen at COP29 is that there will be a defined pathway forward to establish some of the indicators under the UAE framework for global climate resilience that I just mentioned. Because there are different thematic targets, there are experts that have been identified with different areas of expertise. So what we need parties to define at COP29 is how they're going to work with these experts to really make sure that we finally do reach those indicators. Because if we don't have indicators that are developed for the framework for global climate resilience, it's not going to be possible to achieve the goal of that framework for global climate resilience, which is to demonstrate by 2030 whether or not adaptation is delivering for health and those other themes. Some of the things that have been tricky in the discussions on the UAE framework for global climate resilience are what the UNFCCC refers to as means of implementation. So this is finance, technology transfer, and capacity building. And developing countries are rightly making the case that it's impossible to deliver on all of these very beautiful thematic targets unless there are practical measures in place to enable them to do that. There is real pushback, though, from developed countries on mixing a focus with finance and technology and capacity building in with these very logical but completely impractical thematic targets unless those means of implementation are there. It was also clear from a recent discussion between parties and those academic experts that have been identified, parties being governments, sorry, I should have explained that earlier, that even though parties have said that they will hand over the technical aspects of the discussion to the experts, there are still political elements of that, and parties are finding that there needs to be more work perhaps between parties and experts than they'd first imagined that they might be comfortable with. And then finally, that methodological challenges are immense because the indicators that are eventually identified need to be both relevant for the climate process. And we know that although there are many health indicators out there, they're not all as closely methodologically linked to climate change as would be ideal. So they need to be both relevant, but they also need to be feasible. And just for those experts to have to sift through the indicators that have been proposed, they currently need to go through a list of over 5,000 indicators, and they've got a very limited amount of time to do it. So it's going to be an incredible feat of work to get it done. Sorry, there was a duplicate slide in there. On addressing health impacts, so looking at what happens when adaptation isn't sufficient. This is what the UNFCCC refers to as loss and damage. And health is really considered by the UNFCCC to be a non-economic loss. This doesn't mean that there aren't financial implications of health impacts. It's just that these are harder to quantify than it would be for a commodity that is traded. And something that can also make health impacts harder to quantify is that many of them are slow onset. So although the impacts of wildfires are generally very acute, very short term, and the same for the impacts of heat, in the case of infectious disease transmission and in the case of malnutrition and food insecurity, these are things that extend over a much longer period of time, and it's trickier to measure the extent to which the climate is affecting those health implications. So there are two agenda items on loss and damage at the climate COPs. One is the fund for responding to loss and damage, previously referred to as the Loss and Damage Fund. And that was established at COP27 after literally decades of advocacy and prioritization by the most vulnerable countries and by civil society. This should say operationalized at COP28, not COP29, my apologies. But although this fund has been operationalized, there is no adequate finance at all in the fund. And the funds that were pledged at COP28 were only 0.7% of the finance that is needed to address loss and damage. So it's really a paltry and very nominal amount. So although the fund is set up, we need money to be put into the fund. One of the ways in which we expect loss and damage finance to come up at COP29 is the hope that there will be a loss and damage sub-target under this new finance goal, the new collective quantified goal. So while climate finance has historically been very focused on mitigation, and there is some momentum growing on adaptation, and there's almost none for loss and damage, what we hope that we will see at COP29 is a commitment to more balanced distribution of climate finance across those three priorities, because we know that so much of the world already needs adaptation and loss and damage finance, and mitigation alone is no longer sufficient. And
Yes,
then on
other 2 minutes.
Thank you, Lily.
Yeah, thank you.
On the Santiago network on loss and damage, this is really about technical assistance in quantifying and responding to different losses and damage. And there's a chance that this could be really valuable for helping understand the health impacts in particular. And this is my last slide. So beyond the negotiations, how we're going to see health featured at COP29, the 18th of November is Human Development Day, and health will be discussed under this. There'll be a high-level thematic discussion on climate and One Health and human development. And we understand this is announced on a webinar hosted by WHO with the COP29 presidency as a speaker. There'll also be a continuity coalition from the presidencies of recent COPs to talk about how health can be more sustainably integrated into the UNFCCC agenda. On the 20th of November, there'll be Urbanization Day, but this will also have a really heavy focus on health, and there'll be a declaration for resilient and healthy cities. And then finally, the COP presidency also emphasized the links between health and the agriculture initiative. And then, of course, big thanks to WHO, who are producing another special report on climate and health in time for COP29. And I will stop there. Thank you so much.
Thank you, Jess. Very interesting presentation. And now we have Dr. Flavia Bustreo, from the founder of Partnership for Maternal, Newborn and Child Health. Do you have a video of Flavia?
Good morning, good afternoon, and good evening. It's really a delight to participate to the 3rd International One Health Conference. My name is Dr. Flavia Bustreo. I'm currently the chair of the Governance and Ethics Committee at the Partnership for Maternal, Newborn and Child Health, PMNCH, as we call it. It's very important to be part of this conversation with you at the humanity crossroad for climate, child, and maternal health. This is really at the heart of what we do at the PMNCH. At the onset of our conversation and discussion, it's important to realize that the health of our planet and the health of our people are clearly interlinked and are threatened currently by a complex wealth of what we call polycrisis. We have climate change, increasingly climate change, biodiversity loss, pollution, antimicrobial resistance, emerging and re-emerging pathogens, as we have seen with the COVID-19 crisis, the mpox, and the numerous threats that we see to health of our population. One point I'd like to make at the beginning is that these polycrises are actually man-made. They are due to the man-made destruction of the environment, the land transformation, also conflict over resources such as water, and of course, increased greenhouse emissions, which is the essence of the climate change crisis we live. Therefore, the one sustainable health approach is critical to reevaluate whether our current approaches that are sectoral, health sector, social sector, environment sector, economic sector, whether these approaches are actually valid, or whether we shouldn't look at a more realistic approach that brings together these challenges, human health, ecosystem health, animal health, through a sustainable and, most important, equitable lens. And when we talk about equity, it's very important we look at which population is most affected by this current polycrisis. And here I would maintain to you and to the colleagues that are participating that women, children, and adolescents are among the population that disproportionately are suffering the consequences of this polycrisis. Let me just give a few examples to substantiate these claims. Number one, the COVID-19 pandemic has dramatically shown the close connection between the environment and human health. And we saw during that crisis, for example, that children, even if they were not the most directly impacted by the disease COVID-19, they still were the most impacted by the disruption of the health services that were linked to the pandemic. And as a result, we had more than 25 million children that didn't get the common disease immunization, the childhood immunization services. Also, we saw that sex and gender barriers were present at all stages of the COVID-19 response in relation, for example, to vaccine rollout, in relation to the testing and development of vaccines that didn't include, for example, pregnant women, didn't include at the beginning children under the age of 5 years. And in addition, women that, as you have to remember, constitute 70% of the health worker workforce. They were at the forefront of the COVID-19 response, and therefore they paid the price both for their own health, but also for their own mental health, and they were burned out because of the response to this pandemic. Similarly, when we look at the climate change crisis, this is also not gender or age neutral, and it is exacerbating the vulnerability of women, children, and adolescents across the world. Let me quote some data from the Office of the High Commissioner for Refugees, which clearly says that 80% of the people displaced by climate change are women. And close to 90% of the burden of diseases attributable to climate change among the displaced population is borne by children under 5. Also, it's not just the displacement that is linked to the climate crisis, but women and girls are often responsible for performing the household duties, collecting water, and this exposes collecting woods, and this exposes to a greater risk of waterborne disease and also air pollution, including indoor air pollution, because women and girls are the ones that perform the cooking tasks that are so important. The climate-related disasters are also associated with increased risks of complication of the pregnancy, and they are associated with increased pregnancy losses, restricted fetal growth, low birth weight, stillbirths, preterm births, all the outcome of the normal birth are disrupted by the climate-related disasters. And as I said before, we should not forget the deleterious impact of air pollution that is currently an attributable factor of 15% of all low-term birth weight of children, and also a third of all preterm birth, especially in low-income countries. Now, one aspect that I like to stress for this audience is, in general, when we talk in global health, when we talk in One Health, we consider that adolescents are the healthy, not affected by threat, but the climate change and the climate disasters that we see, we have demonstrated that are associated and threaten all the 5 domains of adolescents' well-being. A significant impact on good health and optimum nutrition of the adolescents, including mental health, with what we signal an increase in anxiety and what we call a phenomenon of climate anxiety among adolescents. It also, climate change threatens the connectiveness and the positive values of adolescents, the safe and supporting environment and the learning, because it disrupts the normal work of schools and the teaching environment. And I want to stress also that not all adolescents and young people are impacted in the same way, that we really need to look especially at the adolescents and young people that are already living in humanitarian and conflict setting. Of course, adolescents and young people that are living in small island states and that belong to the indigenous population that have less capacity to adapt to the threat of climate change. So all these growing risks and these growing crises clearly stress to us that we need at this particular moment to take an approach that is not just looking at the sector, that is not just looking at our health response, our capacity of the health sector to adapt, but that we really need to look at a One Health approach. And for us, this One Health approach is critically has to have at the core what is happening to women, children, and adolescent health, if it has to use equity approach, because as I said, these are the populations that are most impacted. Now, how do we do that jointly? I think fostering the One Health approach to pandemic prevention, preparedness, and response is critical. We also need to develop an integrated package of care that has women, children, and adolescent services clearly included and at the core of that emergency management and primary care settings. Also, we need to look at policy and investment in climate mitigation and adaptation to achieve the targets that the world has set at the Paris Conference of Parties and at the numerous Conference of Parties that follow that. And also we need to continue to ensure and augment the women and young girl participation as equal in decision-making in the critical efforts for biodiversity conservation and ensuring an harmonious ecosystem between the environment, the animals, and the humans. So for us, also we look at the importance of strengthening social protection system that responds to climate and health vulnerability. At the Partnership for Maternal, Newborn and Child Health, we are committed to working with partners, with the One Health Conference and the different partners that are present to really ensure that we see those commitments to address the health and well-being of women, children, and adolescents across the world. We are committed and supported in doing so by a recent resolution of the World Health Assembly, where all the countries of the world have made this specific commitment also to address the interlinkage of health of women and children with the climate threat. And we are supported by what we call the Global Leaders Network that is chaired and spearheaded by His Excellency, the President of South Africa, Cyril Ramaphosa, and supported by the PMNCH, which gives the political power and the political push for these commitments to really be realized. Overall, we would like to work with you and address this unfinished agenda and contribute to the health and well-being of women, children, and adolescents in the world. Thank you very much for your attention.
Thank you to Flavia for this important contribution on maternal, newborn, and child health, because these are the topics of the Congress Together Mediterranean Area and Climate Change. So we have to pay much attention to this side of the health, because these are more fragile population, and disaster, crisis, war are many consequences on this population, and so we have to protect and to give some direction to the institution for to support much more women and children. So we have the laboratory of insect and parasites, Benaki, Phytopathological. Thank you.
Thank you. Now, with my presentation, we're going to change the subject. I'm an entomologist, so we are going to present you how the mosquitoes are realizing this, what we are calling climate change. So, yes. So, we're talking about One Health, diseases, climate change. We need to remind you or inform you that as a country, and especially the National Public Health Organization, is doing a very thorough surveillance for some diseases related to vectors, like mosquitoes, sandflies, and probably you know that sandflies and leishmaniasis, also known in Greece as kalazar, is related both to dogs and humans. So this is a typical One Health approach. But of course, today, because we have a limited time, we're going to focus something that is happening in Greece and Europe, West Nile virus. And of course, the risk of Aedes vector-borne diseases. So very briefly, how is the mosquito control structure in Greece? The responsible authorities for conducting mosquito control programs are the municipalities and the regions. So they make a tender, and there is a subcontractor who is doing the mosquito control, of course, under the responsibility of these stakeholders. And this is very important because the rest of the stakeholders, which are mainly the Ministry of Health and the Ministry of Rural Agriculture, Rural Development, the Ministry of Rural Development and Food, are responsible to issue some ministerial circulars, mainly for how to do this mosquito control. Mosquito management maybe is the most proper word. And of course, the authorized biocides in Greece and in the European Union. So, as Benaki, we are coordinating a very big, one of the biggest projects of surveillance in Europe, in Attica region. We have 55, maybe more than 55 monitoring stations, and these traps are collected weekly, and we record every mosquito species in both sexes, females and males. But the most important is that these outcomes are translated to interactive maps, and every Friday they are available to our stakeholders, which are responsible for mosquito control in the region of Attica. And collecting mosquito is not something innovative, something new, but how you deal with your data and how you make them, let's say, operationally available to the stakeholders is very critical. And this project is an ongoing project now 4 years, and also supported with some extra monitoring stations that we are trying to identify as an early warning system, the West Nile virus in the vectors before going to the humans. And all this data are, as I told you, is always available to the responsible authorities. But why we're dealing with mosquitoes? Why we are working, we do research for mosquitoes? Is only the biting nuisance? No. Behind mosquitoes are deadly diseases, vector-borne diseases. And this is what we are trying to stop. Of course, it's not nice to go out, drink my coffee, my drink, and mosquitoes ruin my quality of life. But of course, the most important are the diseases. And most of the management plans are trying to reduce the risk of vector-borne diseases in a certain areas. We are traveling, and together with us, vectors and vector-borne diseases are also traveling. And this is something that, let's say, create many alarms, not only to our country, but also to European Union. And that's just to mention that there are several spots in Europe with vector-borne disease, a small epidemic, chikungunya, Zika, Dengue, which are related to invasive mosquito species. The most known vector of this family is the Asian tiger mosquito. It's a day-biting mosquito. Probably you all know this species, biting you during the day. It's a black mosquito with white strips. So, and unfortunately, very recently in Cyprus, we recorded a new invasive species, which is considered the primary vector for all these diseases, let's say more aggressive and more dangerous than Asian tiger mosquitoes, Aedes aegypti. And this, as you can see, makes us worrying because on the right, there is a new vector, and on the left, there are diseases, and in the middle is Greece. So we don't want this to be connected somehow. What is the problem with Aedes mosquitoes, Aedes invasive mosquitoes, like Asian tiger mosquitoes? The problem is that we cannot find the breeding sites because they are, let's say, they can find breeding sites in urban areas, and these are cryptic breeding sites. So what we are telling during our trainings with the pest control companies, with the stakeholders, with the people that are dealing with the pest control, is that you need to have a fantasy. It's a typical example of a breeding site in urban area, which was full of larvae of Aedes albopictus. Okay, so that's why we say fantasy. This is another typical breeding site is in buildings that are abandoned, and they used, for example, plastic covers. So the plastic covers were full of rainy water and were full of also with mosquitoes. So these are typical breeding sites that we need to identify, and it's not easy. Some years ago, experts from Europe, we suggested a management plan for Aedes albopictus, the Asian tiger mosquito. And this was based on the public health risk. So what we suggested is that even the risk is low, we need to do surveillance, traps, monitoring, and of course, raise awareness of our stakeholders and the public. Because eliminate breeding sites is very important and critical to manage these vectors. We discuss a lot about climate change and all these effects to humans. But let's see what means just a tiny differentiation in the climate for mosquito. Okay, this is the classical, the most typical mosquito that is a cosmopolitan species, Culex pipiens. You sleep with hair during the nights. So, if the temperature is around 30 degrees, which is now, let's say, a nice temperature for Greece, it's not 45, it's 30 degrees, the egg will hatch in 1 day. But when it is 20 degrees, it will hatch in 3 days. It will not hatch when the temperatures go below 7. I cannot remember the last 2 years these degrees in Attica region. And what about the biological cycle of this species? When the temperature is 30 degrees, is less than a week. So means that lay the eggs, and in 7 days, you have mosquitoes. And this is the answer when people are asking why we have mosquitoes during winter, because there is no winter for mosquitoes, for these vectors. And this is from our data, only the last 2 years. You can see that there is no zero anymore during the winter period. And this is the main vector of West Nile virus in Greece and in Europe. So the next question was, okay, the vector survived. What about the West Nile virus? So we recorded that there were many areas in region Attica where our traps were collecting hundreds of mosquitoes during the winter. So the next step was to check these vectors for the presence of West Nile virus, to see if this virus can survive during the winter period. Okay, and unfortunately, we identified some species, specimens that were positive to West Nile virus, which means that both the vector and the virus can survive the whole year. And this was the beginning of our findings, because invasive mosquito species, they are like a tourist in Greece, but somehow they love our place and they became a permanent residence. So the next question was, okay, can they survive during the winter like Asian tiger mosquito? So typically we recorded that it stops its activity during December. But the last 2 years, we notice that it does not stop. And sometimes we also collect eggs. Eggs for mosquito means that they receive a blood meal and they lay eggs. So they are active. And this was a very, let's say, impressive recording, because, and we published it in one of the Lancet papers, together with this abnormality that we recorded on December 23, 2023, with the temperature. So this means that the moment that the climate changed, the vector adapted. Okay. So what we suggest in our manuscript, in our paper, is that leave your traps during the winter in Europe to see what is going on to the rest of the countries, especially in the northern eastern Mediterranean countries. Okay. So I think we are going to be surprised also if these traps will remain during the winter active in other regions. We had this knowledge, how to do surveillance, how to monitor vector and vector-borne diseases. And unfortunately, a year ago, we had one of the, let's say, one of the biggest disasters in Greece. It was Daniel in Thessaly. I'm not going to give details about this disaster. The last year, I'm also acting as a member of the board of directors in the National Public Health Organizations. And at that time, they asked us to help with Thessaly because floods means water. Water means breeding sites. So they were expecting mosquitoes. And because this area was the target, the main target of West Nile virus last year, they were expecting increased number of cases. So what we did, based on our experience that already explained you, is we created a group of experts, of entomologists, epidemiologists, and people that are considered as stakeholders, right? Like people from the region of Thessaly, municipalities, people that are health workers, that they are in the first line of control in this area. And what we suggested is to have data. So we established more than 50, almost to, if I remember well, 80 traps, and data were collected almost daily. And we evaluated this data daily, and we targeted, suggested biocides or elimination of breeding sites or whatever action was possible to be done. And the result was that after the floodings, we had less cases of West Nile virus compared to the period before the floods. And this is because we had a very good data production. And again, it was all the time available to the stakeholders to decide the proper actions on time. So take-home messages. Continuous integrated entomological surveillance, because this will give us immediately any new result related to climate change. Identify which mosquito species is present in a certain area, because different mosquito species are different vectors for various vector-borne diseases, like West Nile virus, dengue, Zika, chikungunya, malaria, which is not, let's say, we eliminate malaria in Greece, but a few years ago, we had some autochthonous cases, so we are in alarm. Of course, communication. We don't produce this data for us, only for science and published papers. We produce the data to be available to the relevant stakeholders. And last but not least, our surveillance network is also, let's say, be present in the point of entries, because this is important to record let's say, as an early warning system, to record any new invasive species coming to our country. So that's why in region of Attica, in collaboration with the region of Attica, and of course with the National Public Health Organization, the main point of entries in Greece are, let's say, under surveillance, and we collect data almost weekly to be sure that no new species will be recorded to our territory. Thank you for your attention.
Thank you very much. Very amazing and suggestive presentation. Now we have finished with the speakers, keynote speakers. So if you have any questions for the keynote of the, please.
No.
Sorry. So I have a question for Antonios. So you said that the diseases are on the left and the vectors are on the right, no, in Cyprus. But do you have, so this means you have no cases of dengue in Greece like in France or in Italy we have, or like chikungunya in Ravenna like in Italy or another part of Europe? You are not experiencing in this country any of these diseases, and so you are worried that they can come from the left?
Yes, when we're talking about diseases of this kind, the dengue, chikungunya, and Zika, we divide it in two categories, imported cases and autochthonous. In Greece, we have only imported cases.
You have no autochthonous case
Yes.
of West Nile? No.
West Nile, yes.
Oh, yes.
West Nile virus, yes. This is our main problem. But the good news for West Nile virus is that it is not transmitted from human to human through via mosquitoes, via the vector. On the other hand, dengue is the opposite. Every case with a dengue can transmit the disease when it will be bite from a vector, from mosquito. Okay, so yes, we have West Nile virus.
Only imported case.
West Nile virus is autochthonous.
But
and we issued last year a national plan for the management of West Nile virus cases. So we have different categories, and now we categorize each municipality based on historical data and, of course, this year's data. So everybody knows what action should be done. Among the action is not only spraying, it's also communication with the citizens, elimination of breeding sites. So different level, different frequency, and different, let's say, effort. For dengue imported cases, we have another ministerial circular, and we are dealing with every case, even suspected. And we do several actions, including, let's say, with an extra authorization of spraying adulticides, because adulticides are not allowed to be spraying except if you have a special authorization, okay?
So you have a very good public health regulation in this moment for the prevention of this.
We are trying hard. It's not easy. It's not easy.
Thanks. And then I have a question for Antonia, if possible.
Okay.
Sorry, Antonia. Because we are speaking about the healthy properties and sustainability of Mediterranean products, but what do you think about the possibility of contamination of these foods in the why they still where they are being producing by the use the large use of chemicals that we have, or also the deposition of contaminants from air pollution, as we know that there are a lot of contaminants emitted from industries or other sources that can deposit on the soil. Sorry.
First of all, we have a regular examination is the European Food Safety Authority in Parma, and they have systems of checking the content. And then they have also limits. I mean, no, not cumulative. And so, I mean, there is a legislation. And the issue is that how legislation is implemented is a different issue. For example, here in Greece, then you might Benaki Phytopathological Institute is responsible for that. They are doing chemical analysis for contaminants. But what I am asking, if the chemical analysis is performed on a representative sample, and if it is done regularly. And so, I mean, this, yes, but on the other hand, I hope that at least the upper limits, they are respected, because the European Commission, according to several law, they said the upper limit, which through test has been proven not to be bad for health. But the new frontier for microplastic is what there is a need for more data and more pressure. But on the other hand, if you follow the traditional way of preparing foods, you could avoid. And if you, that's what I was speaking about sustainability diet, and the sustainability Mediterranean diet, because the way the foods they were produced and the way they were processed, they didn't include these techniques. But it's very difficult to be done, but it must be done. Otherwise, there is no solution. I mean, we're
Yes. I agree with Antonia because anyway, we are lucky because in the European Union there are controls and the food are sure are more safe than the other country in the world. So this is good, but yes, we have more and more to do at this moment, but less to less. Okay. And now
I have a question, if I may. Yeah.
Okay.
Just a question, because you mentioned malaria was eradicated and it was in the late 40s and it was through DDT. This was not a One Health approach. Do we have today a way to balance our existence with mosquitoes? So only solution is to destroy the ecosystem to save our health, because at the end of the day, we are making much more damages to the health and to environment, as Richard Carlson then underlined in the 60s. So
thank you for the question. I didn't have the time to discuss everything, but yes, when we are discussing with the students One Health approach, an example is DDT. I mean, okay, you want to get rid of mosquitoes, you can use DDT, but is this okay? I mean, you are going to destroy and eliminate only mosquitoes, or even yourself, or the animals. So yes, this was, let's say, an example. Of course, we saved lives at that time, but now the approach is different. I will give you an example in the region of Attica. The main wetland that is producing Anopheles, which are the vectors of malaria, is the Marathon area, the famous Marathon. Huh? So what the region of Attica is doing there is that we collect the data. We see the abundance of vectors, and they are spraying with biological agents, not chemicals. So they respect the life of amphibians, of birds, and target, because this is, let's say, target only mosquitoes, this biological agent, okay? And it is decided when it is necessary, okay? It's very targeted.
Thank you very much. Other question from the audience? Ah, c'è uno dei ragazzi. Beautiful.
I don't understand why mosquito is important on the earth.
First of all, it's my job. If there is no mosquitoes, I would be unemployed. But this is a job. Okay. Your question is mosquitoes. So how many species of mosquitoes are present worldwide? Do you know? More than 4,000. But what we are, let's say, interesting for is only 2, 3, 4 species that are related to humans. Okay, if you want to get rid of Asian tiger mosquito, which is an invasive species in urban area, no problem. Nothing will change in the nature. But the most mosquito species are food for other animals, okay? And don't forget that evolution already showed us that when a species eliminated, another species is taking this place, and sometimes is more worse than the previous. So we don't know if we eliminate the mosquitoes, what will be the next vectors, huh? And yes, but anyway, we would like to eliminate invasive mosquitoes, but unfortunately, due to the cryptic breeding sites, we cannot. Okay.
Okay, thank you. Any question, please? The microphone. Sorry.
Thank you all for these presentations, and I would like to particularly ask Professor Scotti about the rights that we were talking about. We wanted to, your project aims to look for the rights of humans on this context of climate change, but what about addressing also the rights of nature to exist? And because after all, the rights of nature, and once nature exists and it's in balance, then all living organisms, including ourselves, would be in peace, let's say. So thank you.
Okay, thank you for your question. Really interesting and fundamental, because in this moment we have to avoid the conflicts. If our approach is in terms of different rights, rights of humans versus the right of nature, the approach is a conflict approach. But from a legal perspective, in Europe, in different part of in other parts of the world, there are a different approach to nature. But in Europe, our approach to nature and to the environment is not to create a conflict between human rights and rights of nature, but the approach is based on duties of humans versus right, not the right of the environment, but the general duty to respect the environment. So it means that the eco-centric approach, the eco approach, is not something against rights of human, is something that we are approaching in order to foster the protection of human beings and vice versa. So it means also in Europe there is a project of a directive to for the rights of nature, but now the project is not going on, and is a project for legislation for the rights of nature. But also with this legislation, the project of this legislation, the intention was not to ratify the right of nature against human beings as a prevalent interest, but it is a way to strengthen environmental protection, because we know that we have a huge building of environmental legislation. In this moment, the legislation is perfect, but the point is to implement this legislation. So the approach to foster and to focus on the right of nature, it's only way to strengthen the duties to protect the environment. The human health.
As the human health. Once
it's not
we have these rights, but we also have these obligations to nature in order for us to have this balance with the ecosystems.
The point is avoid conflicts, because in future we will see conflicts between human beings and rights. For example, the case of mosquitoes is a clear case of conflicts. And when we face these conflicts, obviously, human being is our first commitment. So we have to save life. And it's what we saw for COVID-19. The prevalent interest is to save the life of humans. So, but adopting, for example, one solution is to try to adopt nature-based solutions also to solve the problem of the spread of virus and pandemics, in order to avoid the traditional aggressive way to solve problems also for human health. So I think that we are importing in the Western countries the lexico based on the rights of nature without the culture that is behind this concept in South America, for example, or in Philippines, in other places of the world where the judges are recognizing the rights of nature. So the approaches are different, but I think that there is the main goal that is to create harmony between human being and nature.
Okay, thank you very much.
The last question from Augustine.
Thank you very much. The last speaker, I just want to ask you, sometimes, we tend to, when we speak about climate change and the consequences of climate change, we tend to forget that the biggest consequence of climate change is creating ecological imbalance. And for example, the only problem of that mosquito commits is the effect of a human disease. So I wanted to ask the last speaker, what would be the most appropriate thing? Eradicating mosquito completely or developing like vaccine to treat malaria? What would be the best thing?
So there are different questions, and some of them are, let's say, not related, because malaria is not an urban problem, unless you are talking about Stephensis, which is a different case in Africa. But for malaria, because we are talking about huge breeding sites like wetlands, mosquito control can do a good job. But of course, vaccine is another tool in our toolbox. Unfortunately, we don't have yet good vaccines. And as far as I remember, for dengue, the new vaccine, due to the situation that happened to Brazil, Brazil bought all the vaccines for dengue. So yes, if your question is vaccines, yes, but this will not solve the problem. Huh? We need to continue to do our routine control, which is elimination of breeding sites, education of citizens not to produce mosquitoes, not to leave breeding sites in their backyards. Okay, and of course, regions and municipalities and stakeholders to do proper control in public areas like wetlands, storm drains, anything that collects water. Okay.
Okay.
But we cannot eradicate mosquitoes, even if we want. Sorry. We are trying, but we are failed. Huh?
Because when I hear it sound very drastic.
I'll let you use DDT, which is another story.
Okay. Thank you very much. We go to the oral presentation of the days. The first is Caroline Shelley, and From Sea to Plate, the plastic pollution problem in the food chain, a review.
Hi, my name is Caroline Shealy, and I'm from the United States in Columbia, South Carolina. I'm currently a senior at Wofford College in Spartanburg, South Carolina, and today I'm going to be discussing my paper titled From Sea to Plate, the Plastic Pollution Problem in the Food Chain. The rising concern for plastic pollution is not only considering pollution in the marine habitat and terrestrial habitat, but also for the marine and terrestrial organisms, including humans. Not only do plastic bottles and bags have great effects themselves, but they can decompose to even smaller plastics known as microplastics and nanoplastics. Microplastics are smaller than 0.5 millimeters, while nanoplastics are between 1 and 1,000 nanometers. These plastics can have many abbreviations, but the most common ones are PVC, PET, ABS, PMMA, and PP. The fate of plastic pollution can ultimately end up on the plates of humans through seafood. The plastic travels through different trophic levels, from zooplankton to small fish to bigger fish to humans. Plastics can create numerous problems that disrupt the human body, such as oxidative stress and reproductive problems. An abundant amount of research has been done that follows the life of plastic from being polluted into the waters to the transfer between trophic levels. The fate of human health lies within these studies as they examine the problems that plastic pollution causes within an entire ecosystem. Further research should be studied on the long-term effects of plastic pollution within humans due to the pollution increasing greatly by the years. So some key words that my paper kind of falls around are plastic pollution, trophic transfer, microplastics, health, and food chain. So an overall summary of my paper, as I said before, is on the impacts of the marine and terrestrial habitats, as well as the organisms that live on each, the decomposition of plastics into these micro and nanoplastics, the common harmful plastics in the studies and their abbreviations, the fate of plastics and how they can end up on the dinner plate of humans, and the harm to humans, which include many things, but mainly oxidative stress and reproductive problems, which are of great concern. So plastic pollution in both the ocean and on land is not a new concept of studying. Many individuals, however, do not understand the great depth of danger that comes from the transfer of plastic, specifically microorganisms, in the food chain. Microplastic pollution can be discovered in both marine and terrestrial habitats and enter humans through ingestion and inhalation. Within the food chain, plastic particles can accumulate through either biomagnification or bioaccumulation. Biomagnification is the increase of plastic particles seen throughout the food chain. This starts from small organisms such as zooplankton, who absorb the plastic particles and eventually end up ingested by humans. When the zooplankton who have microplastics are consumed by fish, which are then consumed by bigger fish and eventually humans, the human will have the greatest amount of plastic because the plastic build up from being passed from one trophic level to the next. Bioaccumulation monitors the amount of plastic within one organism. For example, bioaccumulation can be monitored within a single fish's lifespan and accounts for plastic built up throughout the entire existence of the fish. With both biomagnification and bioaccumulation, human health is at risk from plastic ingestion from organisms in the ocean. Plastic ingestions begin from fish in the ocean and can make its way to the dinner plate of humans. The global annual production of plastics exceed 320 million tons, while half of that is just single-use plastic. Most of the plastic is non-biodegradable and not recycled and ends up all around the world, including both the land and ocean. Reports show that 1.1 to 8.8 million metric tons of plastic waste per year enter the ocean from communities by the water. The first reports of plastic particles found in fish was published by Carpenter in 1972, and he studied both larvae and adult fish. He found white polyethylene spirals in the intestines of many fish along the coast of New England in the United States of America. From the 1950s to 2018, more than 7.8 billion tons of plastic, or 7.8 billion pieces of plastic, have been produced around the world. Furthermore, as of 2018, 380 million tons of plastic have been produced globally. So going into the first study, I'm first going to discuss the methodology and then what the authors found and the results. So a study by Miranda and colleagues in the Marine Pollution Bulletin examined the plastic contents in fish along the coast of Salvador, Bahia State, in northeastern Brazil. The fish that were caught were cut open to examine the stomach contents and then separated into natural foods and plastic problems. The plastic debris were then further separated, quantified, and then categorized depending on the size in centimeters, shape, and color, as you can see in Figure 2. The fish species were then categorized depending on whether they lived in a pelagic or demersal habitat and where they were on the trophic level. The stomach content of 32 species were examined. So this study discovered that only one type of plastic was found in the 32 fish specimens, and this included 11 species and 9 families, were resin pellets. The largest pellet size recovered was between 2 and 5 millimeters and found in 5 fish. Following that, the next size was 1 to 3 millimeters. The median particle size of the study, oh, excuse me, that's my next slide, sorry. So yes, as you can see in table 1, this just displays each taxa of the fish they studied, the number of fish in each of those, the number of plastic and the size of the pellet, and the habitat and trophic level categories. And then figure 2, as I said, just shows you how they divided the plastics. So this separate study reviewed plastic, particularly in fish found in the North Sea. The North Sea is greatly used for fishing and shipping, so plastic pollution is of great concern. The researchers obtained 1,203 common North Sea fish species, which included the herring, gray gurnard, whiting, horse mackerel, haddock, Atlantic mackerel, and the cod. Of those, 33 contained plastic, with the highest frequency of fish with plastic found in the southern part of the North Sea. The gray gurnard and mackerel species caught contained no plastic, and the researchers only considered plastics that were greater than 0.2 millimeters. The median particle size of the study conducted was around 0.8 millimeters. Table 3 displays the 7 different species of this study. The largest percentage of plastic was discovered in the codfish found at the first bar, the 49 to 55 degrees north, with 14.9%. The second greatest percent was found in the last column of the 49 to 60 degrees north with 13%. And the remaining percent plastic found in the species was between 0 and 6.2%. The fish were taken from the 3 different locations in the North Sea, which included the southern region, northern region, and then the entire North Sea. So study 3, this is conducted by Leslie and her colleagues, and they discovered and quantified the pollution of plastic particles in human blood. Prior to their study on human blood, studies have been done on plastic found in human feces. This provided evidence that microplastics can be excreted through the gastrointestinal tracts of humans. Leslie and her colleagues conducted research on human blood because blood makes up 6 to 7% of an individual's total body weight. This blood transports oxygen, nutrients, and these plastic particles to the body's organs and other tissues. The only way for the plastic to exit the body is through elimination by renal filtration, biliary excretion, or deposition into the liver or spleen via the capillaries. This study focused on the analytical method development and measurements of the blood to quantify 5 of the high production polymers found in plastics, and their abbreviations are seen on the slide: PPMA, PP, PS, PE, and PET. Blood samples were obtained from 22 anonymous healthy non-fasting individuals from the Netherlands. Double shot paralysis, gas chromatography, and mass spectrometry was used to analyze the blood samples. The samples were then extracted and measured in duplicate consecutive series with many blanks in each series that were the control groups. Because depolymerization products of PET could be present, because depolymerization products of PET could be present, the researchers used a reagent to form DMT. Studying human blood is especially important because the human placenta is permeable to plastic, which can also be transported to other organs through the bloodstream. So the next study, the researchers took samples from 24 species in remote southern Pacific islands that were caught or sold for human consumption to study the plastic ingestion from the fish. The study took place between May and August of 2015, October of 2015, and from April to May of 2016. The fish were taken from local markets and fishermen from French Polynesia, Lord Howe Island, and Henderson Islands. These fish were intended to be eaten by fishermen or sold at local markets. So these researchers examined the gastrointestinal tracts of 126 fish, and they discovered microplastics in 7.9% of individual fish and 25% of the species. The more common fish contained plastic, 9.7% of plastic, while 60% of that plastic was found in the intestines. And this collection of plastic is likely an underestimate of the true levels of plastic in the South Pacific Islands. So plastic pellets are commonly mistaken for natural prey and food for many species of fish due to their size, shape, and color. And a picture of this was seen under Study 1. The diversity of shape and size can be easily confused by fish for food, which allows this durable plastic to enter the food web. Plastic pellets are a great threat in aquatic environments due to their patterns of accumulation, while they also transfer contaminants that are absorbed from their surroundings. The fish containing plastic pellets in the study, conducted by Miranda and her colleagues, most likely mistook the plastic pellets as food floating in the ocean, leading to the ingestion of plastic. And again, this was Study 1 that I just went over. So Miranda and her other colleagues also discovered plastic particles in sharks, rays, and other species of fish outside of their study. The amount of plastic found in the marine life is continuing to grow steadily. The ingestion of this plastic in marine life is a growing threat to the wildlife, as plastic pollution is found in all coastal and marine environments around the world. Samples have been taken from beaches, reefs, the open ocean, and mangroves. The plastic discovered has been everything from pellets, debris, to other objects of any size. The synthetic polymers of these plastics are classified as hazardous waste, and the risk of injection between trophic levels is rising, as well as the negative health impacts on humans. Although some resin pellets are lost unintentionally into the river, the fate of the pellets still lies in the coastal and marine environments. So going back to discussing the second study that was done, the most common fish containing the plastic was the codfish, and this is a very popular fish for meals, as I'm sure you've probably had a codfish in your life. The frequency of fish containing plastics was significantly higher in the southern North Sea, with the highest frequency lying in the cod from the English Channel. The large percentage of plastic found in the cod would eventually end up in the stomachs of humans who consume these fish, along with the high percentages of plastics they contain. The 6 plastic particles in the study were analyzed with FTIR. And one of these was PET, as I mentioned before, and this is a common plastic found in the production of plastic water bottles, plastic bags, and food containers, making it easily exposed to humans. To quantify the quantity of marine litter is ever growing and makes up between 60 and 80% of plastic. This increase in plastic is recognized today as a major water quality issue and will continue to increase due to the increased land-based plastic sources. From the pellets to ingestion of microplastics, bioaccumulation occurs when the toxins of plastics enter the food web at one trophic level and builds up in that individual organism. This not only harms the individual organism, but passes through biomagnification to other trophic levels and eventually increases the concentration of plastic within the food web. The organisms that carry the microplastics transfer to other organisms when they're eaten, and this is called trophic transfer. This leads to a greater risk of humans consuming larger amounts of plastics due to the trophic transfer of these microplastics. While many organisms are affected by the plastic pollution, the exact number is very difficult to estimate due to the billions of organisms affected. Dutch researchers tried to answer this question in 2015 as they discovered that the number of marine species who swallowed plastics or become entangled in plastics have doubled since 1997 from 267 to 557. And this is found in my references under Plastic Soup Foundation 2020. In current times, this number has risen to over 2,000, while only a limited number of species have been studied. In addition to the study, Swedish scientists discovered that nanoplastics enter the brain of fish through the trophic transfer and lead to abnormal behavior. The nanoplastics were found in algae that are eaten by water fleas, which are then eaten by fish. These researchers created simulations of this food chain with the presence and absence of nanoplastics. The fish that were not in the environment with nanoplastics did not experience abnormal behavior. The abnormal behavior of the fish exposed to nanoplastics included slower eating habits and hyperactivity. The accumulation of nanoplastics in the fish began to slow the fish, leading them to being easier prey, which can disrupt the natural food chain. Plastics have not only been found in the stomachs and intestines of fish, but also in the guts of invertebrates, turtles, and other larger animals that are often indented for consumption by humans. In 2014, at least 170 marine species were exposed to plastic ingestion and was increased to 690 in 2015. This entry of plastic into the food web occurs both directly and indirectly across all trophic levels. Direct entry occurs through filter feeding, the gills, and consumption from floating in the water. Indirect entry occurs when a predator consumes through biomagnification. Discovered in honey, sugar, and beer. Although much of microplastic contaminations occurs through the marine trophic transfer, microplastics have also been discovered in honey, sugar, and beer. Although the long-term effects of microplastics are unknown in the human body, the adverse effects include oxidative stress, disruption of energy balance and metabolism, and the disruption to the immune system. The presence of various pathogenic species have been discovered on the surface of microplastics that contain harmful chemicals such as bisphenol A, PCBs, PAHs, chlorinated pesticides, BFRs, and antibiotics that can cause carcinogenic and mutagenic effects. As the number of plastic particles transferred through trophic level increases, further investigation should be done on the long-term effects of human health. Additionally, with new facts about trophic transfer, humans can be more precise on which fish they eat and research.
Thank you.
Just one last.
Just one another speaker and for 10 minutes, and then we have our breakfast. Okay. We have Carolina Belenguer-Hurtado that talk about eco-anxiety. Please, Carolina, you have a total 10 minutes. Thank you.
Hello. Hello, I would like to thank the organization for having selected this work for the presentation at the Congress. The title is Eco-anxiety, the emotional intelligence, increasing resilience to face the health challenge due to climate change. Yeah. Are you?
Can you see the presentation? You can share
the presentation?
Full screen. Yes, you can share full screen.
Full screen.
Yes.
One moment. Yeah. Okay. We know that science warns of looming disasters due to the climate emergency, the resulting eco-social crisis, and
Carolina, sorry, we cannot see the full screen. If you go full screen, please.
the full screen. Okay, again.
1 sec.
One. One moment, please.
Is it okay now?
It's okay now? Hello?
No, just share full screen.
Vea modo presentación. Modo presentación. Presentación. Reproducir desde el principio.
Okay, and then go in presentation mode. If you have some problem, I can share for you.
Okay.
Compartir.
Yes.
Desktop. Compartir ahí. And
Perfect.
perfect. Okay.
Yeah, go.
Okay. Then go. Ya, pero necesito la segunda. Okay. We know, restart. We know that science warns of looming disasters due to the climate emergency, the resulting eco-social crisis, and the relation to high carbon lifestyles. Among the impacts standing out, the increase in eco-anxiety is especially relevant, and this research delves into the emotion as well as the thought and behaviors that accompany them with a gender perspective. This situation caused an increase in psychological stressor on certain groups of the world's population, especially among those being more exposed to environmental conditions due to the jobs, activity, or circumstances in which their lives take place. It could be said that people with low incomes, migrants, women, or minors live in situations of vulnerability. The holistic approach of One Health examines the mechanisms by which mental health and change in the environment relate to and influence well-being. This research supports the idea that emotions play an important role in how people cope with climate change. The goal of the study was to identify the most relevant emotion for the Spanish population related to climate change. In addition, correlation with socio-demographic variables such as sex, age, or income level were sought. Likewise, the relationship between the matrices of emotion, the level of cancer, and pro-environmental behavior were evaluated. The interview model was developed especially for this research. Recruitment was done via email and WhatsApp among the general Spanish population aged 18 to 19 years old during the month of June 2022. And the interviews were conducted via video conference. Questions were asked about the cause that originate the emotion and their implication in daily life. The interviews also made it possible to highlight the narratives and metaphors that underline the paradoxes of the climate change problem. In the final selection, 11 emotions were chosen, representing almost 70% of the total number of emotions named. The selected emotions are sadness, helplessness, anger, concern, hope, frustration, rage, fear, disappointment, guilt, and outrage. Good. The results show significant difference in some emotion, as can be seen. For example, women are more likely to feel and express hope than men. Emotion of guilt, outrage, fear, and sadness appear more frequently the lower the income level. And the research revealed the tendency to be more worried and angry the older you get. Due to the time I have, I can only briefly comment on two of the emotions that have been most relevant to the study. Sadness, which is defined as the loss of an object or person that is highly valued, is said to be felt mainly by these three causes that appear on the slide. But what I would like to highlight is the consequences for the behavior that it has. When we feel sad, we tend to withdraw into ourselves, withdraw from the world, or isolate ourselves from other people. However, concern is an emotion that is characterized by the fact that all thoughts are imprisoned by a single idea that is repeated constantly. Let's say that you can think of anything else, and that this idea is being turned around. In general, worry leads to looking for solutions to the problems that arise. We can say these two emotions can cause opposite behavioral consequences. At the end of the interview, each participant was asked to give an overall score about their concern about climate change on a scale of 1 to 3. 1 is no or almost no concern, and 3 is very concerned. You should bear in mind that many people have an easier time thinking about the emotion generated by climate change if they describe the specific behavior they carry out in their day-to-day lives. The behaviors that have been collected in the research have been classified according to the estimated individual responsibility with the environment. The next slide shows the classification of the behavior. And these two variables were analyzed, and a significant difference was found between them. It is noteworthy that the group of people interviewed who have consolidated behaviors requiring a greater commitment to the decarbonization of the planet expresses a significantly higher level of concern than those who have implemented change of lower behavioral, psychological, and social cost. If we look at the slide, we can see that the emotion matrix of the three groups are different. The emotion most named by the group having incorporated behaviors with the greatest impact on mitigating climate change or the most commitment to the health of humanity is concern, while in the group showing low impact behaviors, the predominant emotion was sadness. If you remember, concern is a mechanism used to handle problems, aimed at finding constructive solutions to conflictive situations. This reaction has allowed the survival of the species since it focuses on conflict resolution, allowing us to detect threats to welfare, health, or justice. It also allows us to generate ideas that increase the prosperity of humanity. However, sadness and mourning for losses usually lead to a state of isolation, lethargy, withdrawal, desolation, or dullness, in which it is very likely that behavior was paralyzed due to grief or anguish for the future. In most interviews, a large number of emotions arise from the economic, health, cultural, or political condition in which the interviews are immersed. And the vulnerability perceived is related to the resources available to them. This situation gives rise to the dilemmas between what should be done and what is done to reduce the consequences of ecosocial crisis. In turn, both emotion and their resistance shape the relationship people have with the context in which they live, even if they are unaware of it. Respondents who recognized the emotion they felt and used them to manage their thoughts were more likely to be able to initiate transformation aimed at achieving a more equitable and sustainable society.
Carolina, you have 1 minute.
Okay, these people, thank you, stress the importance of listening and being attentive to their emotion in order to make decisions that benefit both nature and humanity. The mission of eco-anxiety as a matrix that gathers climatic emotion is to warn the danger, to set off the alert in order to initiate the necessary change. If emotions are ignored or denied, solution will be hard, be sought or found. Consequently, it could be said that emotional intelligence could play an essential role in implementing the change towards a more sustainable, just, and egalitarian society. Thank you very much for the attention. And if we have some few minutes, we can comment if you would like. Thank you.
Thank you, Carolina. Very nice presentation. And so we have our coffee break, so enjoy.
Enjoy the coffee.
Thank you very much.
Sì, forse si chiama sì, va bene. No, no, abbiamo tagliato a metà, adesso li facciamo dopo. Becchiamo il coffee break, ma esatto. Però perché per le giornate grazie. Yes, most of it. They're fast. Basically, we stop here and then we're gonna try this all the time. So the same section, just the case. Oh, yeah. How are you? I received it. I take the presentation. Sorry for taking it. No worries, no worries.
Okay, now we start and we'll continue with the oral presentation.
Need to recover my back. I'm sorry. Yeah, sorry.
Ancora dobbiamo finire,
La sessione precedente.
Certo.
Sì?
Sì, sì, ce ne sono 3 ancora.
Wow.
Poi vi cediamo il palco. Okay, we have Hamza Khalifa that talk about climate change and mental health.
Colleagues, we're gonna restart, please.
Climate change and mental health, the impact on youth and in low and middle income countries, a narrative review. Please keep silent. Okay.
Hamza Khalifa, I don't know if you are online.
Yes.
Hamza?
Hello, everyone.
Okay, thank you. Thank you very much. Thank you for the patience. Also, please, the floor is yours for your presentation. You have 10 minutes.
Hello, everyone. I hope you're doing great. My name is Hamza Khalifa. And I'm
Sorry, Hamza. You can share full screen mode. We can just see the presentation now.
Okay.
You can press F5 if you want.
Like this?
Or share the full screen. Maybe you can share the... Okay, perfect. Please.
So, hello, everyone. Hope you're doing great. My name is Hamza Khalifa, and I'm presenting on behalf of my team. Our research project was about the impact of climate change in the mental health and state of youth in low and middle income countries. So this is our roadmap for today's presentation. We'll start with a brief introduction and deep dive in our methodology and the results we found. And we'll end with a summary, conclusion, and a policy recommendation. In introduction, as everyone knows, that climate change is a global crisis that has numerous effects on everyone, from the smallest animal to the largest planets and universe. But our research was focused on youth population in low and middle income countries because it's the most vulnerable part of community, especially for their younger age, but also for the geographical locations where they're living, where the economic state is not great, and the level of healthcare systems, which is not very developed for coping with mental health issues. So we conducted with my team a narrative review to explore how researchers are taking this problem in their daily research. So, as explained in the introduction, we found a critical gap which needs to be more researched on, that there is a lack of studies measuring the impact of climate change on youth of low and middle income countries' mental status. So we conducted a search strategy using defined terms across multiple databases. We used PubMed, Scopus, World Health Organization database, and American Psychological Association. So we highlighted the articles between 2022 and 2024 for specific reasons, especially for after the COVID-19 pandemic, and to highlight the recent gap. Our keywords was focused on our search goals, as it's highlighted in the presentation, and we included all articles with full text availability and capable for analysis. So yes, we started with 177 articles collected from all databases. After full text screening, we included 30 study. But when we highlighted our outcomes and what we need to measure, the final included studies were only 13. So the first important result we found after data collection and screening and analysis is the geographical and where the studies were conducted. So it's a great result that we found there was various regions, including in the east and the west from all the globe parts. The dominant study designs were cross-sectional studies, which highlights the importance of the studies were very short and didn't take enough time to measure the real impact. The sample size was fair enough for all the studies. Our major finding is that the researchers found a clear correlation between the impact of climate change on youth mental health status, which is a very great endpoint that major mental health issues like depression, anxiety, and post-traumatic syndrome was caused by a climate change disorder or by a climate change crisis, especially the extreme weather events caused by pollution like floods and storms. Additionally, some of studies raised the importance of the global warming effects and the high temperature levels are leading to food insecurity, to less farming and animals, which leads to less mental health status by creating a food insecurity and eco-anxiety environment. After our findings, this is the conclusion we came up. Based on the sample size of the founded studies, we should highlight that they were all short-term studies. So this is our address for future researchers to be more long in considering of time, to be cohort studies, not just cross-sectional studies that doesn't measure the real impact of climate change. Also, we need to investigate more the effective resilience and coping strategies, but developed by the young itself and also the government and health systems to reduce the impact of this pollution, global warming, and food insecurity by creating resilience methods and community engagement with the youth, because they are a very important part of the society. So yes, and also we need to foster international collaboration from the high-income countries to help the low and middle-income countries by showing them how to create and how to implement the good economies and the good strategies to effectively manage the global impact of climate change on mental health. Because not only low middle-income countries are facing the climate change, also high-income countries. And as we see, the high-income countries are facing it more critically and more and better than the low and middle income countries. So this, by fostering international collaboration, this will help them to deal with the climate change more better. Also, we have to secure funding for mental health initiatives, especially research and long-term research. So I hope you enjoyed the presentation, and I'm waiting for your questions.
Thank you. Very meaningful presentation. And we have my little but great Paola Rapisard, that talk about study of effect of climate change on emerging pollutants in drinking water, Interact project. Please, Paola, the floor is yours.
Thank you. Good morning to everyone. I would like to thank the moderators for introducing me and my professor for support me always. Well, one of the most crucial issues for public health and environment is the quality of water intended for human consumption. And I want to emphasize the importance of so-called emerging pollutants, substances that are became progressively widespread in our ecosystems and in the water we drink. In Catania, the water source depends almost exclusively from the deep groundwater from the Etna volcanic massif, replenished by snow and rain that infiltrate the soil. And the water characteristics are two and are high purity and mineralization. However, the climate change impacts directly the water contamination and also the availability and the quality of this water resource. And vulnerable regions such as Sicily, for example, are facing the water scarcity and the risk of contamination due to the events weather extreme, such as the Medicane. Okay. The European Parliament and Council have issued a directive number 2020-2184, which was transposed into Italian law with the legislative decree number 18/2023. Don't worry. Okay. Okay. In this decree, there is the introduction of new limitation for emerging pollutants in drinking water, such as nonylphenol, PFAS, bisphenol A, and also some pharmaceutical like 70-beta-estradiol to ensure its safety. However, much remains to be done regarding the nano and microplastics and also the metallic nanoparticles, and which are being monitored as potential contaminant but are not included into the decree. The real problem is that many of these contaminants can be potential endocrine disruptors, so can interfere with the hormonal systems and cause health issues such as reproductive disorders and also, for example, cancer. In our 3-year project involving the University of Catania and Citra SPA, we want to announce a monitoring of the drinking water in Catania for analyze the previously highlighted substances. Until now, our aim is twofold. The first one is a creation of a questionnaire. This questionnaire is created using Lime Survey. Lime Survey is a platform open source for designing and managing managing in online surveys. And this questionnaire will help us to collect the information about the exposure on adult population in Catania and this province on the emerging pollutant in the drinking water on Catania. The data will help us to understand and assess the health and environmental problem issue and develop a strategy management. In this moment, the population recruitment is still ongoing. Instead, the sampling of drinking water takes place at 6 different sites in Catania, and especially in so-called water dispenser distribution, as shown in this image. And we used a amber sterilized glass bottle, and we let run the water for a few minutes to ensure representative samples. Moreover, each sample is labeled with data, with location and time to trace the proper traceability. And we also record the temperature and the weather conditioning. For our project, we will use various analytical tools to analyze the water contamination. As a matter of fact, first, the high-performance liquid chromatography with ultraviolet and fluorescence detector will help us to analysis of salicylic acid, 70-beta-estradiol, PFAS, nonylphenol, and also bisphenol A. We will use also the intuitively coupled plasma mass spectrometry for the determination of metal nanoparticles, and the SEM, the scanning electronic microscope, with an extraction patent method for the analysis of micro and nanoplastics. Finally, the yeast-based screening systems will assess the endocrine activities by detecting the estrogenic and androgenic interference samples, offering a key insight into the potential health impact. Sorry, okay. In the first part of the project, we developed 4 analytical methods using the high-performance chromatography with the salicylic acid, 70-beta-estradiol, nonylphenol, bisphenol A. And we used a water reverse C18 stationary phase for the separation of the molecule. Instead, for the mobile phase, we use a different concentration of solvents. As a matter of fact, we have the salicylic acid and bisphenol A with a 14% of acetonitrile and 16% of milky water. Instead, the other 2 molecules, 70-beta-estradiol and nonylphenol, have a 70% of acetonitrile and 30% of milky water. The mobile phase flow rate was set at 100 milliliters minutes for all the compounds, and the injection volume was different. 10 microliters for salicylic acid, 20 microliters for 70-beta-estradiol, 15 microliters for the nonylphenol, and final 25 microliters for bisphenol A. Furthermore, the variable wavelengths was set at different wavelengths for just 2 molecules. The salicylic acid with a 240 nanometers and the 70-beta-estradiol with 200 nanometers. And the last 2 molecules are better detected, the peaks are better detected with the fluorescence. So for the nonylphenol, we have an excitation of 220 nanometers and an emission of 305 nanometers. And finally, for the bisphenol A, an excitation of 225 nanometers and an emission of 310 nanometers. We conducted various tests to optimize the mobile phase, the flow rate, and also the detection condition, achieving the clear separation and sharp the peaks of each molecule. Until now, we collected 48 sampling from January to August 2024, covering in different seasonal periods. And the initial results indicate that all the compounds are below the legal limits. So in this case, this shows that the drinking water of Catania is free from this contaminant.
Moreover, in these two slides, we can see the value expressed in MDL, so in minimum detectable levels, which indicate the lowest concentration of a chemical can be detectable in the identify of the sampling of the water. Finally, the project is still ongoing, and we continue with the analysis of the molecule of each interest. And regarding the microplastic and nanoplastic samples are yet been extracted, and they've been soon processed. At the same time, we are developing analytical method for the metallic nanoplastics. In conclusion, despite the primary result positive that shown the water drink in Catania is free of this contaminant, the monitoring is crucial to confirming the safety and the sustainability of water resource over time. Thank you for your attention.
Thank you, Paola. And now the last oral presentation of this session, Edgar Bulas-Osorio, that talk about the impact of climate variability in chronic pain and fibromyalgia, a narrative review. Thank you, Edgar. The floor is yours.
Okay. Hello, good morning. Thank you for coming, and thank you for the organization of this wonderful event. Today I'm going to talk about the impact of climate variability in chronic patients, including fibromyalgia patients. Sorry. Okay. First, we're going to talk about the rationale, why it's important to talk about pain, particularly in this context. And then we're going to talk about the inclusion criteria, what results we found in our narrative review, and finally, a summary or take-home message. Why do you think it's important to talk about pain in this context? Because pain is very prevalent in our society. When we talk about chronic pain, about between 20 or even 50% of the population refers some kind of chronic pain. That includes musculoskeletal pain, neuropathic pain. Fibromyalgia is also included in neuropathic pain. And other kinds of pain, including bladder pain, temporomandibular dysfunction, etc. It's very prevalent. And one point that's very prevalent, particularly in our female population. Chronic pain is an expensive disease. It's an expensive syndrome. Costs a lot to healthcare system. When talking about pain and climate, we've known for many years, since Hippocrates, imagine that weather can affect how our patients refer their pain, both in their intensity and their tolerance for pain. Around 75% of the patients with arthritis self-refer that their pain is influenced by weather or by the climate. The thing about pain is that it's multifactorial. It has to do with, we talk about sex, it also has to do with age. Most chronic age patients are female patients over 50 years old. Also has to do with other social and economic aspects or conditions. Also has to do with if you live in a high income or low income country. Epidemiological studies have detected some weather climate variables associated to this subjective aspect of pain. But despite much research, there's still no consensus about there's really an objective mechanism that can describe why pain worsens in this kind of patients, in patients with chronic pain. We tried here, our aim was to summarize the impact role of climate variability, both in chronic pain and specifically in fibromyalgia patients. So we asked ourselves, what is known about the relationship between climate or climate change or climate crisis and pain, specifically chronic pain and fibromyalgia? Our inclusion criteria included, well, our inclusions were first papers with chronic pain, both in their titles and abstracts, then specifically papers about fibromyalgia, not other comorbidities associated to fibromyalgia, English and Spanish language papers, papers written in the last 20 years, unique articles, and both quantitative and qualitative analysis, also self-reports, most papers about chronic pain and weather or climate crisis association are mostly self-reports. We excluded papers before 2004, non-human subjects, and papers with low patients, less than 5 patients. Our search strategy was looking for keywords like chronic pain and fibromyalgia associated with weather, climate change, or climate in our classic databases. So the mechanism is still uncertain. There are a couple of hypotheses. Mostly have to do with mechanical aspects, mostly mechanical articular aspects, specifically shoulders, knees, hips. Also include some kind of vascular dysfunctions also associated to articular disease, and dysfunction in central nervous system regulation or thermoregulation. Like this image. This image summarizes, first of all, we have these meteorological aspects that can influence both peripheral nervous system and or at the same time central nervous system that might affect thermoreceptors, pressure receptors, and mechanical receptors, both in our peripheral and central nervous system. That modulates other systems like autonomic nervous system or immune system, and then we begin a counter modulation between all the systems that might be influenced by weather or climate change. And that at the end all modulates our subjective or the way how we feel pain intensity or pain tolerance. Our results indicated that most chronic, are going to divide this between chronic pain patients and fibromyalgia patients. First, chronic pain patients. Results indicated that chronic pain patients usually felt more pain, more intensity pain, whenever there was a decreased barometric pressure, an increased relative humidity, higher precipitation, and enhanced wind speeds. What has to do with climate crisis, because according to what we are know now, this may get even worse. And for everyone, especially women with disabilities, and especially women with disabilities in low-income countries, in the context of climate change. About 10% of our patients referring chronic pain, they mostly reserve that the weather characteristics that impacted them more was the temperature, and less percentage when talking about pressure, when talking about wind speed. The things that we still don't know which subgroup of patients is which. That's one of the main ideas of doing this paper and doing this work. I'm talking to you right now. Because there's a subgroup of patients with chronic pain that are weather sensibles, have weather sensibility, and there's another group of patients that doesn't have weather sensibility, that have the same chronic pain diagnosis. And we still don't know why the difference. There's still no conclusive evidence to confirm or deny it from an objective point of view. As I told you, mostly pressure and temperature are the most associated variables when modulating pain in the chronic pain patients. I also found this interesting. Most of us here may have had a surgery or something like that, or similar. Scars are also described to be affected by weather. This is especially important in athletes. And one of the mechanisms suspected that it might be a counter-regulation or sometimes dysregulation associated to nociceptive nerve fibers, especially C fibers or profound pain fibers. Also found this interesting. The most referrals both to the primary care physician, to the emergency room, or to another kind of medical specialist were during or after high precipitations, specifically in women. Still not sure why. Also, rapid climate changes does affect pain sensibility in this kind of patients. So now we have two things. Now we have that extreme weather can affect pain intensity and tolerance on patients, mostly female patients, but also rapid temperature oscillations can affect the intensity and tolerance of pain in this kind of patients. The things that weather has is a dynamic variable when associating it with pain. It can bother sometimes, it can't bother sometimes, can bother a lot depending on the season, it can bother less depending on other season. The things that the response is individual. There are not two people alike, there are not two patients alike, there are not two patients with chronic pain syndromes alike. When talking about fibromyalgia, there's also much less literature about it. Fibromyalgia apparently also has a subgroup of patients that may be affected more in relationship to weather change. The things that the evidence says that it doesn't affect as much as intensity or tolerance, but might affect more its quality of life, and there might be a deregulation between climate change, rapid oscillations, oxygen temperatures, and fatigue in fibromyalgia patients. Fatigue is one of the cardinal signs of fibromyalgia, as is generalized pain, and some kind of cognitive dysfunction, including the famous fibroPOC. But according to the literature, mostly fibromyalgia, weather change, affects quality of life and fatigue. There's also a couple of interesting papers that conclude that also fibromyalgia patients may have a dysregulation of the sensory system, mostly a heightened thermal pain sensitivity. So if there's extreme weather, especially hot weather or cold weather, these patients are more vulnerable to worsen their pain clinic. Also in fibromyalgia, more than 50% of the patients associated climate as an influence on their pain. Lower pressures also were associated in some subgroup of fibromyalgia patients with less tolerance and more intensity, more pain intensity. But the things that we also in chronic pain patients, including fibromyalgia, haven't concluded or seen in a specific group associated to weather patterns differences. Limitations about this subject. The mere presence of risk factors such as weather cannot be attributed as a causation because it is multifactorial. Also has to do with where you live, what you did before, and specifically from a medical point of view, other comorbidities. There's great variability in study designs, both from the n number of patients evaluated. The strength for the moment is very poor, and most papers do not consider other variables as kind of pollutants, comorbidities, or even diet. Diet, because of the gut microbiome axis or system, is also very important and can be another area surrounding climate change and chronic pain. Now we should also include gut-brain axis when talking about it. But that's not the objective of this conference right now. So, does weather modulate pain? Yes, in some individuals with chronic pain, and in some individuals with fibromyalgia. The probable effect, mostly in chronic pain patients, is higher than in fibromyalgia patients. In fibromyalgia patients, mostly has to do with fatigue, but not in pain intensity. Who is the most susceptible has yet to be determined. For the moment, we do consider female population with chronic pain. That means pain that has been for over 3 months, or pain that has been longer than one. It's normally expected after tissue reparation. And the idea here is also to give you ideas in order how to study this, because it has been understudied, specifically in patients as complex as fibromyalgia patients. And that's it. Thank you very much.
Thank you, Edgar. Very complete discussion on this topic. And now we have the end of this first session and switch panel. But I have to say one thing, because by the first part of this day, we have a great message that we have done many efforts to support young people to face climate change and insecurity and psychological impact of climate change. And I think this can be done by support, institutional support by school, because school is very important to give many message and many knowledge to the young people. But I think that at first are the family that have to be done much work, because parents have to face day by day young to little problems, little difficulties to can exercite their resilience, the capacity to face problems, and so to face other great problem, work, climate change, and so on. Thank you very much.
Thank you, Margherita, and thank you also, Matteo, Gnes, and Elisa, Scotti. Thank you for the chairs of this first part that was related to addressing the disaster effect. So let's talk about risk now. I invite the chair of the second part of this session, so Dr. Prisco Piscitelli, Melissa Jimenez Gomez-Tagle, and Professor J. Olivieri. Please come to the floor as a chair. Okay. J. Olivieri, Prisco Piscitelli, and Melissa Jimenez. It's a change, but don't worry. Melissa Jimenez.
We are late, so we have to really respect the time assigned to each presentation. No, Domenico?
Yes.
And so I would suggest to start with the lecture of Casimiro Vizzini. I would introduce Casimiro, who has been recently become a friend of our group. Casimiro Vizzini, he comes from Paris. Actually, today he comes from Berlin. He travels a lot because he's the international relationship officer of this foundation, which is based in Lyon and Paris. under the Pasteur Foundation umbrella also, which is named One Sustainable Health for All Foundation. Okay, that is a broad really range of activities, and it works, however, by specific thematic groups. So they have a lot of thematic groups. I am chairing the thematic group on healthy food and food systems. So today is the World Food Day. And so thanks, Casimiro, and please stay in the lot of time assigned to you.
Thank you. Thank you very much. And thank you for inviting me. And thank you, Prisco, and all organizers. So the One Sustainable Health for All Foundation was created. I'm doing my slides from here. Was created. The next slide, please. Was created in September 2020 in Lyon as a response to the COVID pandemic. The idea was to propose collaborative projects and to foster a sustainable health solution according with the SDG 2030 agenda. Okay, thank you. Perfect. The activity started at the beginning of 2021. The idea was to foster the collaboration between public and private entities to address the One Health approach and the integration of One Health, planetary health in the global health policies. I will say that the interesting, no, the other way around. The interesting point and the unique characteristic of this foundation is to gather together experts from all around the world and create a free space in which the gap between the intergovernmental organizations, governance, and the civil society is filled. Because we gather through these two activities. They are the two main activities of the foundation. The first is the forum that is structured, as Prisco said briefly before, but I will give you more information soon. The forum is structured in international working groups, and the experts composing the international working groups are coming from all around the world and from different backgrounds. Of course, the backgrounds of the One Health approach, animal, human, and environmental health, but also different backgrounds in terms, as I said, of origins. So we have representatives from the Parasites, from WHO, FIO, the Animal Health, the World Animal Health Organization, and the UNEP, UN Environmental Program. So it's promoting transdisciplinary approach and operates One Health also in practical, and we will see how in the specific case of risk management today. And then there is also the second activity is more based on policies, the One Health for One Europe for Global Health Coalition. It's mostly based on expert working to advocacy and promote the One Health approach in the global health strategy of the European Commission. We work closely with the presidency, of the European Union Council that is rotating every semester. So we started with the French presidency, and we've been working. I always go back instead of going in the right direction. Instead, working with the rotating presidency of the European Union Council. So it started with French, and now we are working with the Hungarians, and we'll go through every semester like this. So going back to the forum, that is the main activity. This is the activity that I'm coordinating. It's to build a community of international experts, as I said. One Health and planetary health are both approached. The international working groups I mentioned are thematic working groups, but this year, with the beginning of the new biennium, we started with a new path, and we have two international working groups that are transversal, Group 8 and Group 9. I will give you specific information about Group 9 that are based on the transversal themes like the next generation, so working with youth, so junior experts working in the One Health approach from all the disciplines, and the use of the One Health approach in humanitarian settings. So how to practically implement humanitarian approach, One Health approach in humanitarian settings. But we also have a big work in raising awareness. I'm a medical doctor by background, and have been faced often to colleagues that have never heard about the expression One Health, and you have to explain and what you do and why you're doing that. So awareness is extremely important for many reasons, and especially when we talk about antimicrobial resistance or other kind of issues that are at the core of the One Health approach, that still lack of awareness around the world in also the community of general practitioners, for example. Not very good with this remote. The structure of, as I say, we already say the experts and their background. The member organization, as I said, are from different kinds of backgrounds, and they have the role to be in the forum to represent themselves, the organization, in the international working groups with experts, or, for example, just to endorse and validate the recommendations. So at the end of the biennium, we published, I have a copy here, I will show you if I can. At the end of the biennium, we have we publish the recommendations. It was done for the first biennium in a global forum organized in Lyon every second year. And this recommendation compiles the work of the working groups during the 2 years' time. And we asked to our members, so to our community, to validate, to endorse the recommendation in order to have a much more heavy impact in the public sphere. These are the international working groups. As you can see, there are thematic working groups, as Prisco I mean, we are pleased and honored to have Prisco as chair of the International Working Groups in Sustainable Food System. As you can see, we have thematic working groups going from environmental health and sustainability, but also governance, because there is an important issues about governance in the One Health approach. The quadripartite is struggling in this effort, and also about funding, because it's extremely hard today to have an approach in funding mechanism that is not compartmentalized. And that's why, because we're used to fund something that is about climate, we're used to receive funds for something that is related to health or to animal health, human health or animal health. And I mean, it's changing. And for example, at the European level in Brussels, there are a lot of changing movements, new call for proposals that are based on the One Health approach, but it's still very hard to find an open approach on the funding mechanism. Let's go to the group 9. That is the group that is pertinent with this session because they are working on the humanitarian settings, One Health approach in humanitarian settings. The group 9 has the pleasure to have as co-chairs Davide Ziveri, that is Italian, and environmental health specialist at Humanity and Inclusion, the former name of Handicap International, and Dr. Rafael Ruiz de Castañeda, Spanish, but he's a doctor at the University of Geneva, the Institute of Global Health, and the Division of Tropical and Humanitarian Medicine. What was the goal of the creation of this group was to operationalize One Health and planetary health in the settings, humanitarian settings, as I said. And why? Because it's where the health inequalities are magnified, and the impact of climate and environmental crisis is crucial for life of human being in these areas. What are the key barriers of the activities of this group is a mismatch between the donors. As I say, the funding mechanism is still old and not working properly, and the actual needs in the field, the knowledge gaps between the research and the practical field. This is sometimes it's happened often. We explain, we talk about, and this is what the question I made to the entomologist professor before, as like we talk about One Health, but then practically, for example, the young people, sometimes people ask, and what we have to do, what we do that, how can we apply this concept? It's very beautiful to hear interconnection, interdisciplinarity, all these international words that we use, but then practically, when I'm in the field in Bangladesh with sedimentary island population that need to change from one island to another because they're floating, are making disappear these islands. What we have to do, what is the One Health approach? This is what this group is trying to work. They started their activity recently, and I mean, we hope we will be able to provide in the next recommendation something that will be useful for them. And there is a very important study. I still time, I hope. Yeah. There is then finally a lack of documented. For 3 minutes, fine. I will rush. Lack of documented impact on One Health intervention in humanitarian context. As I say, people have no idea, unfortunately. So awareness is important. Key deliverables for the International Working Group 9, knowledge exchange. I won't go into details, mapping and sharing, because as I say, knowledge, to create knowledge, we need to map and share. Tool adaptation, adapting existing tools, because there are tools to adapt and reaction and management of crisis, but so we don't have to reinvent the wheel, but use this tool and to adapt these tools through the One Health lens. And networking and advocacy, as I said, because it's essential to be popular, to become popular with this new approach, because it's a question of changing mindset. This is an example. I will be quick. I didn't go. These are the key deliverables. These are the example of what they're doing. It's an initiative of students of the University of Geneva that are members of the International Working Group. They are creating operational sheets to guide disaster response using the One Health planetary health approach. And I took the example of flooding in Kenya. And as I said, the objective is to create something operational, practical tools for humanitarian organization to manage the health impacts of disasters in a comprehensive and cross-sectoral way. I have to change there. No, again. I don't know if community engagement, stakeholder so the tools are I'm not in the same. Here it is. So these sheets will have an impact and assessment checklist, disease watch list and prioritization, flood impact navigation flowchart. So they will start from this experience of Kenya, of the flooding in Kenya, to create a model to be scaled and adapted to other realities using the One Health approach. It's extremely important to, as I said, map and engage the main stakeholders. As I said before, we need to have governmental organization, non-governmental organization, and the civil society that is working in the field. And then the community. We need the community engagement. It's extremely important because the focus on local community is essential when they are the impacted characters by disaster. And this can be done establishing pre-disaster and post-disaster relationships to support recovery and leverage local expertise to ensure that interventions are aligned with the community needs. I will just be quick. So the idea of the example of flooding in Kenya was to say, starting for something practical that is existing and to promote and create a model to be used in other realities. It's a study, it's starting now. This is a proposal that the students from the Master in Global Health from the University of Geneva, those are the names I wanted really to underline their effort because they are fantastic, and there's an important message to give. It's that to truly grow and make an impact, and this is Dr. Rafael Ruiz de Castañeda that said, we need to secure funding because otherwise this will stay in the University of Geneva and won't have a real impact. So spread the voice. We need support from all the experts and relevant stakeholders. Thank you very much, and I'm sorry if I was a little bit long.
Thank you. Thanks. Thank you. Thanks, Casimiro. And now I would suggest to the other co-chairs really to make respectful 5 minutes per each intervention. No, we have 30 minutes to spend.
No.
Okay, we're starting with the communication. I ask to Maria Fiore to present microplastics levels in intestinal biopsies and subject diagnosis with the colorectal cancer, comparison between healthy and diseased parts, preliminary result. Thank you.
Okay. Thanks, moderators.
Maria.
Okay.
Sì, sì.
Okay, I'm going to tell you the result of
Okay, wait.
this.
Yeah.
The first or
No, the second one.
this?
Yeah, there are rows.
Are there 3 arrows up and down?
I'm not the only one with issues with
No. It's human versus technology all the time.
Okay. I am telling you about the preliminary result of this study. It is a case control study. I want to specify for the students, a case control study is a study design that we use to study to investigate the relationship between potential risk factors and the pathology. In this case, microplastics and colorectal cancer. Okay. So why colorectal cancer? Because this is the 3rd most common cancer worldwide, but also the 2nd most common cause of cancer death. And despite we have a screening to make the diagnosis, unfortunately, usually, often the diagnosed it is diagnosed at advanced stage when treatment options are limited, and this is a problem. Okay, let's go. Sorry. What are the risk factors for this pathology? The first risk factors are, for example, age. And the age, it means that usually we diagnose this pathology in people aged older than 50 years old. But unfortunately now we have also this problem in younger people. And after we can speak about the reason of this. Another risk factor is family history, but also personal history and lifestyle factors. Pay attention to lifestyle factors because we speak about the problem, but we need also to give what's the solution or some suggestion respect to prevention. Okay. The last risk factor is exposure to environmental risk. What's, for example, microplastic, maybe environmental risk. But what's a microplastic? In this meeting, we have spoke about microplastic. I think it's clear that microplastic is related to the constant decrease in plastic production, but also the environment contamination and the degradation that occurs, leading to formation to micro and nanoplastic. It means different size, okay? And the problem is that these particles penetrate human body by ingestion, inhalation, and also dermal contact, okay? Another important aspect is that microplastic is to consider like a cocktail, a chemical cocktail, okay? And the problem is that research on human cells highlighted that microplastic can have different health effects, like cytotoxicity, genotoxicity, apoptosis, oxidative stress, and so on. So in this case control study, we investigate the relationship between the exposure, microplastic exposure, and intestinal biopsy of subject diagnosed with the colorectal cancer. In particular, we compared the healthy part of the intestine and the cancer part. Moreover, we compared this health part of the cases with the biopsy come from the intestine of health subject. Okay, that is a person that got to make a colonoscopy, to have done a colonoscopy, and the result, there is no cancer. So this is a healthy subject. That's clear. The method that we used to prepare the sample and to quantify the microplastics is a patent method. So I don't speak about this. But the analytical method to identify the microplastic is the SEM-EDX, cioè electronic microscope analysis. The result, surprisingly, we found strange result. To be honest, at the beginning, I thought there is a mistake. But we checked this mistake. There wasn't a mistake. Why I tell you this? Because we found higher level of microplastic in control compared to case, and also in the healthy part compared to unhealthy part. We suppose that this may be related to, first of all, to the different structure of the mucosa of the intestine, because in the patients with the cancer, the intestine have a different structure respect to the healthy subject. And another reason may be the different behavior that may have the microplastics depending on their size. Okay, bigger microplastic, bigger sites probably have a different behavior. So another result is that is confirmed also in the microplastic present in the blood, that we have higher level in the blood of cases than in controls, and the diameter, the dimension is higher in the controls, like as you can see from the graphic. Before I said you that younger people may risk also to have a colorectal cancer. And this author found that there is an increased incidence of early onset of this cancer, and they related this with the fact that this person have the age that make them to be exposed to microplastic about 50 years. That is from when the plastic was produced and started to use it with the increasing in the time. So probably this subject are related to an environmental exposure. So the risk factors in the older people and in younger people may be different. Another interesting result is was highlighted by these authors, which found that the plastic particles of 0.25 micrometer increased the propensity for cells migration. So they are potential for metastatic effect. Cioè, the first problem is that the microplastic may be related to the cancer, but also may worsen the situation with the metastasis. The last is that this author found that in a mice model, found that polyethylene nanoplastic can disrupt the intestinal microenvironment, which shape adaptive immune response and favors the established in situ colorectal tumor growth. Cioè, really the evidence in the in vitro and in vivo model are present. What can we do? At the moment, we have continuous the study, finish all the analysis, complete all the samples, and to verify if the results are confirmed. respect to the preliminary result. And also we have to follow some role. We have to work in the future to reducing plastic, but also to improving management, and also considering the cycle of plastic, and pay attention that this cycle of plastic don't make damage on the environment and on the human health. And at the end, also every person has something to do. First of all, understand that we have a duty, that is adopt an healthy lifestyle, like WHO suggested, because it's true that we found microplastics in fruit, in vegetables. What does it mean? That we have not to eat vegetables? No, we have to eat, because vegetables, fruit have substance that can help us to contrast inflammation. And as we saw before, inflammation is an important focus of this relationship between microplastics and cancer. Okay, I finished. Thank you.
Thank you, Mariana.
Thank you. Thank you. The question at the end of the communication.
Thank you so much for this great research project. Now we would like to call online Sefort Nitbabara. I hope I pronounced that well.
No, she's not coming. No.
Oh. Okay, she's not coming. So then we would like then to call online Tanari Genvite or Genviti and Tirayu Merkson. Are you guys following us online?
Yes, yes. Tanari is connected. Okay. Please, Tanari, can you hear us? Tanari?
Yes. Tanari, the floor is yours.
Hello?
Hello.
Yes, you can present. It's your turn.
Can you see my slides?
Yes.
Okay, good. Good afternoon, participants. My name is Tanari Januti, and I am a PhD student in parasitology at Faculty of Medicine, Konkan University. Today, I am excited to share my research on One Health geospatial modeling of Bithynia species snail distribution under climate change for future optic acid control. This is the overall of my contents. Okay. Before I dive into the specific, let me provide some context. Optic acid caused by the river flux or Ophiuchus viverrini remain a crucial public health issue in Southeast Asia, particularly in Thailand, where many people in the area are infected. In addition, infection of Ophiuchus viverrini has been associated with bile cancer. Mortality rate of liver cancer and Ophiuchus viverrini infection rate in Northeast Thailand show a high mortality rate. The reason for the cause can be explained from life cycle. There are required a definitive host and intermediate hosts such as Bithynia snail and cyprinid fish to complete the life cycle. And several factors affect transmission, including cultural practice, like eating raw fish, climate change, altering snail habitats, socio-economic conditions, and environmental pollution promoting snail population. The Bithynia snail in Thailand is different in distribution and geographical habitat. Bithynia funiculata found in north in Thailand, Bithynia semensis coniophorus found in northeast in Thailand, and Bithynia semensis found in the central of the Thailand. In Thailand, Bithynia species thrive in freshwater habitats such as river, lake, and rice paddy, provide optimal conditions for reproduction and continue the river food life cycle. Environmental factors are important for the spread of Bithynia snail, including temperature, rainfall, drought, and water quality. Further support the proliferation of this snail in endemic regions. For understanding One Health approach in geospatial modeling and create a new predicting model of ophiurochiasis problem in high-risk area. I start with the study area that high prevalence of ophiurochiasis viburnum infection from the previous reports. Then population and sampling the snail collection from the field and the snail identified by geomorphology and EI and snailry. Count and examine for the presence of parasites, circular shedding, and the human collect from socio-economic and behavioral factors survey by questionnaire. Then use the geospatial data analysis. The 7 sites from 5 provinces. This is my study area, and the sample size 1,400 persons in questionnaire. I found 11.5 positive rate in the human. This is the water body for my study area. Like this. Okay. 1,329 Bithynia snail examined for trematode, circular shedding, and identify circular based on characteristics of internal morphology. The Bithynia snail prevalence by location show with this chart from 8 to 12%, and for the OV circular in Khon about 0.6%. All of the positive cases that use modify cartocast by Department of Disease Control, Ministry of Public Health, Thailand. All are above 3.5 of 4. Mean they usually eat raw fish, including koi pa, la pa, and prasom. We also collect the climatic data using portable Internet of Things device for air, soil, and water temperature within 90 days in raining season from 1st June to 31st August this year. The average temperature about 26 to 29 degrees Celsius as shown in this graph. All area almost same for air and water average temperature. In the humidity pressure almost same for all study area, and participant in is high at Saipum and lowest at Flogaitis. But the distance from the village to water is high in Flogaitis, measured in meter, and there is human activity such as fishing or live field. Sorry. With the feature selection using random forest, then train the random forest model with grid search series. The important feature show at this graph, water temperature is the most important, then distance to water and the rest. The random forest regression model look a right linear regression model close to 100% accuracy. But we still working on this project because climate data now just only for a rainy season. The data-driven model had to be improved with all season in the study area. We also try to predict world climate data using historical data from 1960 to 2021, then predict 5 years more. In this graph, the data from 2021 to 2027 both match to future climate datasets from world climate. And we assume our prediction model work well with the random forest prediction model. Same as the last result, when we combine human and animal health, such as dog and cat, to this model, Khon still first place for monitoring in northeastern Thailand, but where the participation is high, the snail occurrence are low in Nakhon Phanom. Geospatial modeling helps understand environment factors affect between snail distribution and abundance, including the water quality, species interaction, and habitat suitable. Climate change is expected to alter between snail habitat, potential causing rank expansion or contraction. For understanding this change is crucial for anticipating ophidian transmission and developing control measures using geospatial modeling. Geospatial modeling technique like GIS, remote sensing, and predictive model can be used to analyze the distribution of between species snail and their impact on climate variable. This method can be used to develop comprehensive One Health strategy for ophidian control.
1 minute left.
Rates of climate change scenario into geospatial model can predict future distribution of between species snail, impact ophidian control strategy.
Kennedy, you have 1 minute left.
Thank you. One Health geospatial modeling successful predict future distribution of between species snail, intermediate host of ophidian river folk under climate change, and provide insight for target surveillance and control effort. This is the conclusion. Climate variable, particularly temperature and participants, show strong correlate with snail prevalence, and random forest model demonstrate good predictive performance, and future climate suggest potential shift in snail distribution with an over or decrease in prevalence. And the One Health approach integrate human health, animal health, and environmental factors, provide a more comprehensive understanding of ophidian risk. Thank you for the attention.
Thank you so much for this presentation. We would like to now call Maria Castrogiovanni. The floor is yours.
Thank you for the presentation, and good morning to everyone. What I'm talking about is the relationship between urban spaces, public health, and potential algal blooms in the context of climate change. Harmful algal blooms are due to an excessive proliferation of some phytoplankton species that can cause significant ecological disruption in aquatic ecosystem, and additional can produce harmful toxins. These species can be present in both marine and freshwater ecosystems at different depths, and some care-related, climate-related factors such as temperature, acidification, and nutrient loading can influence the physiology, phenology, and biogeography of these species, and then affect their prevalence, distribution, and toxicity. Harmful algal blooms are constituted by different taxonomic groups that can produce different hazardous toxins. Among the most dangerous, there are microchistins that are produced by several species of cyanobacteria, and polytoxin that is produced by diatoms like as Ostreopsis ovata. Each toxin has different targets in body pathways, and for example, can affect the the body through oxidative stress, apoptosis, cell proliferation, and also the polarization of excitable cells, like in the case of palytoxin. The health impact that occur when we are exposed to this toxin are really of concern because the exposure through ingestion, inhalation, or dermal contact can affect different organ systems. For example, you can see in the picture some of these effects, like inflammation of the walls of the lungs, decrease of renal function, increase of the risk of colorectal cancer, and also promotion of cancerogenic effect in the liver. Additionally, they have also potentially neurological impact because some of them can cross the blood-brain barrier and then damage the neurons. Some epidemiological studies on the health effects of chronic exposure to cyanobacteria toxins have linked them with neurodegenerative disease like Parkinson's and also amyotrophic lateral sclerosis. And for example, this is a population-based case control study that involved two regions in Italy. And in this study, the residential proximity to water was used as a measure of possible exposure to these toxins. And the results showed high odds ratio for both the the current resident near water and the historical residents, confirming the hypothesis that this exposure may increase the risk to this disease. As previously mentioned, temperature is one of the key factors influencing algal growth, and the urban areas often experience higher temperature compared to the surrounding area because of the urban island effects. That is due mostly for the use of materials, the heat-absorbing materials like concrete, and by low vegetation and the human activity in general. High temperature are an issue for health because they increase the risk of cardiovascular disease, of heat stroke, and also heat-related deaths. As a matter of fact, over 4% of summer mortality in European cities was linked to urban Italian effects. The consequences are worse for vulnerable groups such as healthy people, children, and also people with chronic disease. For mitigate these effects, cities can adopt different strategies that are known as nature-based solution strategies, like using reflecting materials, a better urban planning, and most of all, implementing green and blue areas. For example, here we have some bloom spaces in urban context that are used to mitigate climate change effect, while also providing different ecosystem services. The relationship between blue spaces and the outcome of health and well-being, it's complex because it involves different interconnected factors. For example, exposure to blue spaces is influenced by proximity, duration, frequency, and intensity of the contact with with water, that whatever it is, conscious or not. And the exposure may impact health outcomes through different mechanisms. First of all, the mitigation that we talked already, for example, mitigating heat, noise, and air pollution. And in other case, promoting, for example, physical activities or reducing stress. However, situational factors like, for example, the type of blue spaces or individual characteristics like age or sex can modify this effect. Also, there are many actions that can be useful to improve this interconnection. For example, at societal levels, we have the international policies, and at local levels, intervention for improve access, quality, and also safety of these places. The urban blue spaces have many benefits. Among these, the mental and physical well-being, the air quality improvement, the urban climate regulation, but also aesthetic and recreational value, such as well as ecological sustainability. Despite all these benefits, urban blue spaces are particularly vulnerable to harmful algal blooms, especially in the context of climate change and without a proper nutrient management, because higher nutrient loads and higher temperature may increase the risk of these blooms. For example, in this study, they evaluated the water bodies around Wilmington in North Carolina, and they highlight this concern, revealing that people may be at risk while engaging in these activities. As you can see in the picture, there are blooms in these water bodies, and there are also people fishing, kayaking, and so. This is a study about monitoring for a monitoring model for try to estimate the water quality and also assess the parameters influencing cyanobacteria growth, like nutrients, macronutrients, pH, conductivity. And in this study, 35 out of a total 33 basins in Sicily were monitored.
2 minutes left.
Yes, I finished. It's just the last one. And during the study was developed these metrics that identify the degree of need of monitoring for the associated with microcystids and cyanobacteria occurrence. In conclusion, expanding the blue spaces is really important to for climate change mitigation in urban areas, and also for promoting health and well-being of the community. However, it's crucial to manage the health risk associated with harmful algal blooms, like proper monitoring, implementation of research, also education and water resource management, and all of these in order to balance the risk and the benefits of these blue spaces.
Many thanks.
Thank you for that.
Would have a lot of questions for you, Professor Fiore, but in private. In private.
Now we would like to call Edgar Bulos with the topic of stroke risk and outcomes in the age of climate change.
Okay.
The floor is yours.
Okay, well, I'm going to take it like this. Well, thank you very much. Thanks to the panel, to the chairs, and to everyone connected and being here. I'm going to go quite fast for this. Today we're going to talk about stroke risk in the age of climate change. Of course, we're going to talk, why are we going to talk about stroke? Stroke is one of the main causes of death, of mortality in the world. It's the second or third cause of mortality. Stroke is has drastic and very almost tragic consequences for most patients and their families. We're going to talk about exclusion criteria for this paper and summary at the end, and try to explain some mechanisms and some kind of relationship between stroke and climate change. Okay. We all know this from the very well-known Lancet countdown. Climate change is considered the greatest global health threat facing the world right now. That's including stroke, pain, and other syndromes. Climate change each and every year has been definitely recognized as a risk factor for stroke, for any kind of stroke, both male and female patients. Stroke is a major public health hazard. So I told you before, second or third cause of mortality and of disability in the world. And extreme temperatures, and in other cases, even 1 degree more than we are used to be, can impact in a very important percentage the incidence of stroke. Our main objective is to summarize both the evidence and to determine the relationship between climate change and stroke. And we ask the question, what is known, and is there a relationship, as the evidence says so, between stroke and climate change? So for this, we included stroke of any types. There are 2 types of strokes: ischemic strokes and hemorrhagic strokes, also cryptogenic strokes and lacunar strokes. Most strokes are ischemic strokes. There are about 85 to 87% of all strokes happen all around the world. We also selected studies from the last 20 years, between 2004 to 2024. Only human participants, articles and papers in Spanish and English. Sample sizes, big sample sizes, over 5 patients. And of course, also papers with retrospective analysis. We excluded heat stroke. Heat stroke, it's another complete and different syndromatic entity. Also, it can be related to stroke. That's something else, but it's a complete different symptomatic entity. Also, we excluded non-human papers, non-human studies, and also papers with less than 5. We use the following strategy. We search for climate change, weather and environment, and stroke in the all-known and well-known databases. We found more than 1,000 articles. At the end, we analyzed 61 articles, much larger number than in Maine, as you can see right now. Risk factors. We have climate risk factors, as air pollution has been well described, especially PM2.5, and the increase in temperature. But we also have other risk factors, including infectious diseases, in this case, neuroinfectious diseases. But now we know that they can also be modified through climate change. And if we have to summarize what's the main mechanism that can explain how weather, how an external factor, mostly temperature, can affect our vascular system, we should talk about endothelial dysregulation. This cardiovascular stress and inflammatory responses are mainly due to extreme temperatures. We all know that. And probably they're going to get more extreme. Things will get worse, hopefully, before they get better. That's the idea. Climate change worsens air pollution. As I told you before, it's already described risk factors, especially PM2.5, also PM1, and even PM10 has been described as a risk factor for stroke. And also one of the mechanisms that can relate to this endothelial dysfunction can be the rising of the systolic pressure, mostly due to high temperatures. This is very important to take in consideration, especially in southern hemisphere countries, Latin America, parts of Asia, especially Africa, where most patients have really difficult it's really difficult to control the hypertension. These environmental stressors, as temperature, climate change, also have to do with our oxidative system. And once we have this oxidative system affected, then we start seeing a cycle that affects our immune system, that affects our endothelial system, that affects our cardiovascular and respiratory system. And then it's very difficult to get out of this cycle of cardiorespiratory and external risks. So, being exposed to heat being exposed to infectious disease, being being exposed to disease and being exposed to these external weather patterns does influence on our endothelial system. And that can be translated to more stroke, more myocardial infarctions, and more thrombotic diseases. Things not changing, right? Okay, thank you. Geographical variability is evident, says the literature. Countries with a low to middle income are more affected. We already know that. They're more vulnerable. And low-income countries may experience disproportionate heat-related hemorrhagic stroke. This is very concerning, especially in countries when you don't have a rapid and fast availability of protocols in order to take care of stroke patients. There, every second matters. There's a saying in rehabilitation that time is brain. Time is brain.
You have 3 minutes, Edgar.
3 minutes. Thank you very much. Here we can see standard, both the disability age related to low income versus high income countries. Also a standardized death rate in low middle to high middle countries, how it's affected. The burden of disease is definitely going to increase. We already know that. Ambient temperature is the most prevalent factor when it is related to stroke. And it's especially important for the vulnerable population, and in this case, it's women. The incidence of stroke is increasing, particularly in women and in women after 65 years, both in ischemic and hemorrhagic stroke, with more disability. PM 2.5 as one of the main risk factors, air pollution risk factor associated to stroke. Hospitalizations related to stroke are more prevalent during high temperatures or low temperatures. Depends on if the patient lives on the northern or in the southern hemisphere. In the northern hemisphere, has to do both with high and low temperatures, and in the southern hemisphere has to do more with high temperatures. But not only we have to take in consideration high or low temperatures, but temperature oscillations. That's the new thing, especially to consider in climate change era. This heat and vulnerability increases in women, increases in pregnant women, increases in hypertensive or diabetic patients, specifically women. This increase in temperature has marked relationship with death and disability. These weather influences may confer a worse prognosis, and this burden is definitely going to increase as temperature increases and as poverty increases. The mere presence of this as a risk factor cannot be attributed to cause stroke, but it's definitely there. It's a summation of different factors. There are great variability in the studies, mostly retrospective series, and some variables are not considered as pollutants and comorbidities. So this effect can be cumulative, immediate, and delayed. As climate change progresses, the burden of stroke, death, and mortality and disability progresses. The whole idea for being here is to think about effective mitigation strategies, especially in vulnerable populations, mostly women in the southern hemisphere and hypertensive patients. As global warming increases, neurological disease increases. If neurological disease increases, also climate change increases. The idea is to get out of this cycle. Thank you very much.
So thanks a lot. Domenico, would you like to conclude?
Yes, first of all, I want to thank the chair for the moderation, and I want to thank also the amazing speaker that we had today. I will not get long because I know that we have lunch. Just few logistical information that I share. Now this afternoon there is no presentation, there are no conference. but we have the guided visit to Athens, and also with the possibility to see the Acropolis. Now we'll share quickly some details. We have a slide change that done to the fact that many of us want, of course, to see the Acropolis. We can visit the Acropolis. It has a little extra cost, like 20 euros, but we have to meet a little bit before. So the guided visit is anticipated at 16. Yesterday we communicated at 4 p.m. because the Acropolis is closing at 6. Okay, so the guided visit will start at 4 p.m. We will meet here, okay, in the venue of EPLO, and then we go. For the ones that can visit the Acropolis, there is just a ticket to pay for entering these 20 euros. Regarding the social dinner, indeed, everything as yesterday. We will meet at the restaurant at 8:30. I sent to you by message, if you check the WhatsApp group, all the details, the map and the position and so on. It's very near to here, really 2 minutes from here, and we will meet there at 8:30. So thank you very much.
Today is Gabriella's birthday. Auguri.
Happy birthday!
Happy birthday. Happy birthday, Gabriella. Happy birthday. Bye.
Okay. Okay, thanks. I want also to thank the colleagues of Global Pandemic Network and EPLO for hosting us, and thank you very much. See you tomorrow. See you later for the visit and tomorrow for the conference. Bye.